all of our folks that are on Zoom. Welcome to all of you that are here in this room. It might be a little unnerving at first because this is the very first time, I believe, since the pandemic had begun that we have all been able to gather in the same room together. So it's my absolute honor, and I'm humbled to be your MC for today. My name is Mary Ann Maselli. I am the project coordinator for Sandoval County Health Council. I am also on the executive board for the New Mexico Alliance of Health Councils. I serve two roles currently. One is the secretary and the other is the interim treasurer. So if there's anyone who loves math, likes numbers, has some spare time, let's have a chat. All right, so I would like to just thank you so very much for being patient with us. And I would like to call up Reverend Dr. Ann Egan Hayes. Feel free to clap. We're all right.
Thank you. And I need to stand on one of those little stools. Welcome. I wanted us to start with an honoring of whatever that spirit is that you go to for grounding, that lifts you up, that carries you. And so let us now spend a few minutes in prayer. God, by whatever name we call you, we thank you for everything that you have given us that can help us build our communities. Thank you for giving us wisdom to see what needs to be done. Thank you for helping us connect with one another to create good trouble, as Representative John Lewis called it. We are called by you, and we so honor the opportunity that we have to build new systems, new structures that are grounded in equity, that connect us with our communities and with one another. And we ask that you take each and every one of our gifts and multiply those so that together we can continue to make a huge difference. Thank you.
Now, if you know the words, please feel free to join me with our Pledge of Allegiance. Please stand. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty
and justice for all.
You may be seated. I would now like to read our land acknowledgement. Thank you. We always like to take just a moment before we read the land acknowledgement to give the respect that is absolutely deserved and to honor those who have made this possible for us. New Mexico Alliance of Health Councils humbly recognizes and acknowledges we are on unceded territory and ancestral lands of the original peoples of New Mexico's Pueblos. Apache nations and the Navajo Nation, together, we acknowledge the history of genocide, dispossession, colonization, and ongoing systemic inequities while strengthening and respecting relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of this land and respect all tribal nations' sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes and nations who are still here today. I would now like to invite Chris Hudson up to the podium. Feel free to clap, he's pretty awesome. And handsome, right?
I feel like I'm in a dugout back here. I never liked Little League. I just play in the grass, so welcome everyone. Thank you for joining us today, Bennett. My name is Christopher Hudson and Chef. Christopher and Hudson and Chef. Sina sis Butney Nishlin. Sina Geneva Shishin Kia Ani Dashiche Tabaha Dashanella. Those are my clans on my maternal and my paternal side of my family, but for both my mother and my father. We usually introduce ourselves that way. I am from McKinley County, Statewide, New Mexico, Statewide Navajo Nation, in between both worlds, between Indigenous side and Western side. It's very, how would you say, exciting. So I'm doing a little bit of introductions today. I don't want to go too long. I think I have like 10 minutes, but I think we're a little behind. So I just want to welcome you all today. And we're going to be doing a little progress update on where we are at and where we've come. I just want to reflect a little bit on that as we all come from different health councils from across the state. All of us started at different times as the Child and Maternal Health Act was enacted originally in before 91. It's almost been a quarter of a century of health councils. Wow, we can go back to that. It's a long legacy to have, and you know, I've only been a part of it for the last 5 years. I got introduced into it when I was working with my community. I was working with my community to sell them cakes and candy apples throughout the area because I had moved back home and I was finding low opportunities and didn't want to go into serving again. But through that baking back in the past, through bake sales, I found a new way to make money. But I also found a way to reconnect with my community, something that I hadn't done since leaving to college and going back home. And from there, you know, I hooked up with my aunt who had a job for a note taker at these meetings, and I had no idea what these meetings were about. And they told me, oh yeah, we just talk about health and public health, you know, I just have to write a couple of things, it'll be all right. And a year later, I found myself getting more immersed in it, getting more into public health and realizing, you know, how interconnected our communities are in how much our health really goes across all boundaries, not just in like how we take care of ourselves, but how we take care of our environment, our community, our schools. All of those pieces really play into place. So yeah, it's a great legacy to be a part of, and I'm really appreciative of it. So thank you all for welcoming me and helping me grow through this. I know we've all been through this too, as well as growing together. And yeah. Let's see here. Oh, we have pictures up here. I forgot I sent in pictures. So we have me and Terry Rodriguez there as well, former executive director. I don't know if I have one with Sharon, but Sharon's here in person. So shout out to Sharon. We have our new executive director, Valerie. And you know, always in the last 5 years, a lot of great progress has been made in each of these executive directors to carry on a piece of what our health councils need for each of those times that we've had them. We're really very thankful for that. Along those lines as well too, we're really thankful for all of the health councils that have done work across the state to really move things along, especially on the tribal health council side. And most recently, I think we've had at least 4 tribal health councils join us, right? Yeah, that's great. Originally we only had 3 or 4. Now we have a total of 9 or 8. I'm not too sure of the numbers, but it's a lot more. So we're really proud of that. We're really glad that we're finally having recognition on the tribal level, because really a lot of, if we think about New Mexico, it's a lot of legacy in indigenous territory in Western territory and a lot of European and different influences coming from both sides. So we really have to take that into account that we really are diverse. You know, we always talk about it in school, and when I was in elementary, we're really diverse and you really get down to it compared to a lot of other states. So I'm really thankful for having that in here. Let's see here. Another update I think is more recently is since reenacting the Health Council Act, we've been able to move forward in finally establishing a task force within the New Mexico legislature to look at all the health councils and the public health infrastructure within New Mexico. So not only within health councils, but also within the Department of Health. And through that, we've been able to ascertain 9 different recommendations for that, I think, from the task force. And one of those was to fully fund health councils to where they were before or where we need to be for our funding. And this year we're requesting $5.75 million in recurring funding. So we're hopeful to get that all, and I'm pretty sure we will. We have a lot of health councils advocating for us across the board to be able to do this. And we're really excited about that because 25 years is a long time to be working in public health and to help our communities move forward and really just kind of collaborate together, not only on the partner side, but with our communities. I feel like that's another part that's really grown within the last 25 well, since I've been a part of it, and even before then, it's just how much we focus on the community level, the grassroots level, to really find out health priorities and really tackle them together. I think I've gone a little longer than 10 minutes now. I'm just reflecting too much. So we want to thank you all for joining us. We have a lot more pictures here too. I didn't get to go over all of them. We have Pablo Acoma here. I hope everyone online is having a really good morning as well too. Yate Bene to them. And we just want to welcome you all. So thank you for joining us today. Our agenda, we have more. I think next up I have Valeria, our executive director, who will provide us with some vision and strategy and financial overview. So thank you. Yeah. Add her up.
Chris, thank you. Buenos dias, good morning, everyone. It's such a privilege to be here with all of you. My name is Valeria Alarcón, and I am both deeply humbled and excited to be your newly appointed executive director at the New Mexico Alliance of Health Councils. I am a native of Ecuador, grew up in Boston, Massachusetts. That's a whole other story. And moved to New Mexico in 2004. And that has a full circle story I'd love to share with all of you at some point. But I have to say that coming to New Mexico felt like being home for the first time in the States. Sorry. My experiences as an immigrant child, a woman of color, and a 4-time cancer survivor and thriver have shaped my life profoundly. And as a result, I've dedicated my life to social and environmental justice. And at the heart of that is advancing equity in all sectors that I'm involved in. And being part of this sector with all of you in public health is a tremendous privilege. So thank you to all of our health councils. And thank you to all of our public health professionals for all the critical work that you do, the meaningful work that you do in supporting and leveraging our communities and meeting public health needs across our state. I come to you with 25 years of experience in the nonprofit sector. And I want to also take a moment and thank our board members, our funding partners, interns and staff and health councils who work diligently and together to produce and particularly program this gathering today. And to our friends online, thank you so much for joining us. Really, thank you for your dedication. I do have one very brief update about legislative session today. As you may know, the New Mexico Alliance is going to be providing testimony today at 1:30, room 307, for the House Appropriation and Finance Committee. So it's a big deal, HB 49. Yes.
All your legislators.
Yes, funding, fully funding health councils across our state. So your presence is important. Your public comment is critical. So join us, if you can, and hopefully all of you will. If Gary, if we can advance yes, I wanted just to read our mission. And my commitment, particularly in this unified vision of all of us advancing health equity and working on public health priorities, is to work with key partners and health councils at the heart of this work, health councils, in leveraging public health efforts to meet the specific needs of our community. Our mission at the Alliance is to improve the health of all New Mexicans by supporting and strengthening county and tribal health councils, advocating for health equity, and by providing a strong voice for community and public health. And as our co-chair Chris Hudson mentioned, we have 42 county and tribal health councils. So we continue to grow our community and engage more deeply as well. Thank you all. Okay. Relationships are so central to the work and that I do across the board, but how I show up as a partner with each and every one of you. And I know that we haven't had the opportunity to meet in person, and I'm so looking forward to meeting with each of our health councils, learning with you, from you, and partnering with you to address our health priorities in our communities, community-based. This is sort of my little ecosystem of who I want to engage with to learn more from. Obviously, our county and tribal health councils, our core team, board members, consultants, interns, funding partners, and key partners in the public sector, Center for Health Innovation, Department of Health, so on and so forth. So I want you to know that if we haven't met yet, I look forward to meeting with you in the very, very near future. And with all of you too online. The next couple of slides are sort of my proposed strategies. And I just want to preface by saying that, of course, you've all done an amazing work and continue to do an amazing work in partnering, collaborating, in leveraging our public health priorities and meeting the needs of our community members. My commitment to our health council, the Alliance, and this sector of public health is to leverage our partnerships, leverage our shared unified vision, leverage the work that we get to do together. And these are some of the things that have stood out to me as leveraging opportunities. And of course, part of my approach with this work is incredibly inclusive and collaborative. And so these have taken shape as a result of some of the conversations that I've been having so far, and will continue to be refined and revised as we together get to have these conversations. And at the heart of these strategies is partnerships, collaboration, right? So I'll touch on all of these. Community-based public health hub. I see the Alliance along with key partners as a statewide integrated system for community health and advancing health equity. What does that look like? Particularly around creating accessibility with resources, leveraging the shared New Mexico that we have, year-round advocacy. Advocacy doesn't start in December or January of the legislative session. Advocacy starts 6 months before the legislative sessions. So I want to partner with all of you in getting really clear as moving forward, what is going to be our advocacy, strategy, and how do we all get to work together to ensure that health councils in our local communities, get the funding that they need and their health priorities met. Technical assistance is something that we already do. Obviously, lots of opportunities to continue to meet the needs that you have around training, professional development, toolkits, or, specific trainings that you need around organizational development, capacity development, all of that. So we want to always hear from you, and looking at our entire ecosystem. Where are those leveraging partnerships, right, that can really leverage and advance health equity in a more community-based centric way. The next one that I see is the workforce development. And of course, this is also tied to economic development and public health as a sector. So capacity building, having the Alliance be a capacity building hub, that through that technical training and through key partnerships, we can formalize our training to provide educational credit units so that we then create pathways, right? Educational pathways, career pathways, workforce development pathways. So I think there's lots of opportunities in our ecosystem of partnerships where we can leverage our workforce development, our local professional development. Research and advocacy, I just mentioned, right? Advocacy doesn't happen in January, it happens throughout the year, but really looking at how we can standardize and centralize our data. All of you do such incredible, deeply engaged and, of course, demanding time, energy and time around collecting data, right? Completing community health assessment plans, the SHIP, I'm learning as fast as I can. But but for the health councils and leveraging health councils through the Alliance is to sort of standardize that data, to have that data be actionable and serve each council, health council with whatever their priorities are around data, but also the Alliance and within this context of advocacy, right? Because advocacy, one of the pillars of advocacy is showing the impact that we're making in our communities. And that's obvious across the board here with health councils and public health professionals. And so how do we then package our data in a way that is accessible, easy to understand, and offers us the leveraging opportunity when it comes to advocacy? Let me just take a breath and make sure I've covered everything. Yes, so lots of opportunities there. All righty, so health equity pledge and standards. This is not a new idea. I've worked with the city of Santa Fe, and one of the things that we've worked on is on gender equity, especially in the fire department and police department. And there's an organization called 30 by 30 who has created this pledge nationwide with all these standards around advancing gender equity in this particular sector. And I see a similar opportunity for us. I know all of us are working on advancing health equity in one way or another together. And I think there's an opportunity here to standardize that and really walk our talk, right? Because it's not just about having a great, diversity statement. It's this body of work is holistic, it's comprehensive, and it's also opportunity to operationalize and standardize. And we need to, my commitment around this body of work is catalyze systems through equity. So it's not something that we talk about and that we do have a unified vision on, but it's something that we're doing in a very pragmatic, standardized, operationalized manner. That equity is in every area of interaction, every policy, every procedure, every system that we are navigating, right, within this public health ecosystem. So that's one strategy that has come to mind as I've been working in this field, and particularly with health councils and the Alliance. Health equity investment portfolio. This is something that I have worked on with nonprofits throughout the 25 years of experience, really moving from this sort of charitable framework towards an investment framework, because it's about investing in our local communities, be it education, be it elder care, be it health care, clean water, clean air, all of the priorities are really important to our community members. I think there are plenty of opportunities for having folks from different sectors invest in what's really important for New Mexican. And some of the portfolios that I've created for other organizations have been in, foundations, institutions, corporations, obviously federal and state, crowdfunding, circle, donor base, and I can talk a little bit more about that. But an example that I can give you is with early child education in Boston, connecting corporations like Bank of America, Chase Global, Manhattan, can't think of others, but, to invest in early child education programming so they get to sponsor one child care center per county. And it's recurring funding, $60,000, $100,000 a year. And this offers, those educational opportunities that inner city kids wouldn't have otherwise. So there's lots of money out there. That became very obvious too. We learned a lot through the pandemic, right? When we need to mobilize and take care of each other, there are people obviously that show up, 24/7, and there's money out there. It's just about how we get to create this investment portfolio for ourselves, and then, reach out to those investing sources. Last but not least, speaking of impact, data, standardization, and so forth, something that I found to be incredibly valuable also for fundraising, for advocacy, and so forth, is a return on investment. And I know there's been great studies by Sanchez through UNM on the return on investment for every dollar that's invested in health councils. The value back is $4 per dollar. So there's quite a bit of opportunities there to really standardize and really capture what is the impact of health councils, both on the very qualitative side, right? Those lived experiences, those personal experiences, and also on the quantitative side, because we do need to quantify data to convey our message and the critical role that you all play and the impact that you impart in our community clearly to folks that get to invest in the work that we do. So let me pause there. And I'm happy, during lunchtime, but also as we move forward and we get to meet with one another, we'll be sharing these slides, of course. Would love to hear your thoughts, would love to hear, hey, Val, we're already doing that particular, initiative or strategy, but, perhaps we can expand it in this way and so forth. Again, this is a collaborative process. I so look forward to connecting with you, learning from you, working with you on behalf of public health in our communities. So I'm going to pause there for a second as we move on to our next set of slides. And so providing an overview of our financial trajectory, as you can see in 2023, the last 3 years, our funding has tripled. And some of the ways that we have invested that funding, obviously, increasing the capacity within the Alliance so that we can be of greater support to health councils. So that means staffing, right? And also improving, designing, implementing, and improving internal systems around board development, stakeholder engagement, defining and implementing policies and procedures, whether HR, operational finance, financial management, and obviously programming and services that the Alliance offers. And what you will find is that we've had an average monthly operating expenses of $25,000 in 2022, $41,000, and projected for 2023, $75,000. FY22 reflects a full award from Robert Wood Johnson Foundation for Operations. And also you might see for 2023, go to the next slide, sorry. I guess the previous one, my apologies. There's a negative because some of the funding will be ending, but the Alliance is working on getting additional funding. We have a grant that's gone in for the National Health Institute. So fingers crossed. Let's see. And if we can move to the next part. So this is revenue sources. You can see in 2021 what our revenue sources, resource streams look like, 2022, and then projected for 2023. Obviously, foundation grants, a grant with DOH that's going to be ending in FY 2023. This is why HB 49 is also incredibly important that we advocate today. And so that investment portfolio is one of our very, very top priorities so that we can diversify our revenue sources. Thank you. Yes, so 2023 program and services, these are some of the technical assistance that we will be focused on: advocacy, community engagement, capacity development, obviously the continued work with Share New Mexico. And here are some related public health issues that are currently also in the legislative session: the climate change focus, behavioral health, environmental, and social determinants on health. And here's where we dip a little bit in future funding. And again, just to reiterate that we are very much focused on diversifying our revenue sources. So this investment portfolio is going to be key. And of course, if you have any ideas too and want to strategize together, it would be so lovely to connect with you. And I will pause there. And Thank you so much for your time and dedication and commitment to this critical work. And who do we here? Sorry. Wendy, yes. Come on over, my friend. Thank you to our friends online.
All right, that was a lot of technical stuff. So I would like to just take this moment before I bring Wendy up. I would like to just take a few moments and give some shout outs to our health councils that are here, that are on Zoom, that are absolutely doing the work in the field, not able to be here, not able to be on Zoom, but you are just as important and you are just as much of a priority for all of us at the Alliance as if you were with us today. So Acoma Pueblo, Bernalillo, Canacito, Band of Navajo. And you know I'm Sicilian, so these names in New Mexico are a little different for me for pronouncing. So if I don't roll something or pronounce something appropriately, it's absolutely no disrespect intended. I just don't want to sound like I just came out of the wheelbarrow as I'm trying to say patron. It doesn't even feel right. Chavez County, Cibola, let's see. Coche de Pueblo, Colfax, Curry, Debaca, Dona Ana, Eddy, Grant, Guadalupe, Harding, Hidalgo, Leah, Lincoln, Los Alamos, Luna, McKinley, Mora, Nambe Pueblo, Otero. Oh, this is another one of those. Picurus, Hickory, Pueblo, I'm so sorry. Quay, Rio Arriba, Roosevelt, San Ildefonso Pueblo, San Juan, San Miguel, Sandoval County, Santa Clara Pueblo, Santa Fe County, Santo Domingo Pueblo, Sierra, Socorro, Taos County, Tesuque Pueblo, Torrance County, Union County, Valencia County, Santa Clara, Santo Domingo, McKinley. I'm pretty sure I already said Bernalillo, but we're gonna give him an extra shout out because, you know, we all are in this together, right? Okay, so again, my apologies for that. But I would like to bring up Wendy. And also, just a quick note on Wendy. Does anybody know that Wendy is the mastermind behind Share New Mexico? And if you don't know about Share New Mexico, health councils, it is an outstanding resource. We can go to
sharenm.org.
sharenm.org. And you can go through their the little click down tabs and you can say, I am in Sandoval County and I am looking for a food bank or I am looking for a certain kind of resource to help our folks. And you can use these drop down menus and they will come up with a listing of what would be available. What is amazing about this beautiful platform that Wendy created is that it takes a village. And we all know that Wendy does exceptional work and she works tirelessly to ensure that we as health councils have resources that we need to have available for our folks. Like in Sandoval County, I have over 185,000 residents. And there is food insecurity, there is housing insecurity, there is clothing insecurities. And it just came to my attention recently because, you know, as a project coordinator, I had not really given any consideration to the fact that if I'm not out there in my county and I'm not updating the list of resources that I have available in Sandoval County and sharing that information with Wendy or with whoever the brilliant minds are behind the updating of the Share New Mexico website, then I'm doing a disservice as a project coordinator and as a health council member. So I would like to challenge and encourage all of you to go out into your counties, make some phone calls, stopping by, seeing who has got what to offer for your residents in your county, and then pass that information along to the Health Alliance so that we can make sure that the sharenm.org website is continuously up to date so that when folks come to us, which we know that they do, and they say, I'm having to choose between putting food on the table for my family or gas in my truck to make it to work to provide a roof over my head for myself and my family, we can say, you know what? You don't have to worry about food because here is a resource for you for a food box that you can get on a continual basis. So if I can get a pledge from everyone today in this room, as well as all of you amazing folks on Zoom, to please get out in your communities, reach out to the folks that you know, because we all know someone who runs a food bank or runs a clothing bank or runs some type of an organization that is doing great work like the church in the Placitas where they have donations that come in that they distribute. And if we can help the Alliance to keep this website updated, then I can tell you that I could have saved myself 9.5 hours of having to call every food bank and stopping by and not necessarily being received all that well because they're like, listen, it's COVID, you should not be in here. But I'm like, there's no fresh fruits and vegetables and people are hungry and that macaroni and cheese is not going to cut it for everyone every day. So if we can help keep this website up to date, it will help us and we can then help our counties. So if I could just get a pledge from everyone to do that, I would be so grateful and I'll stop talking about it. Okay, so without further ado, Wendy, Wintermute.
As Marianne said, it does take a village. Share New Mexico started with you all. We started from the ground up and built all of our resources with your help. And the reason we say we have the best, the most comprehensive and most up to date, not entirely up to date, but most up to date resource page in the state is because we have you all on the ground telling us what's happening. The infrastructure that the New Mexico network of health councils provide is like phenomenal, absolutely essential. We are the public health infrastructure for New Mexico, and it's all about you. So kudos again to all of the health council. Yay! We do want to recognize our board, but I also want to take a moment and recognize the staff. Geraldine is our senior. Can you believe this? Geraldine Antonio is our senior member of the staff. She's been here since 2019. Keeping us going to the last few years. Geraldine, our tribe building liaison, and our wonderful staff, Kiana somewhere here somewhere. Our new project manager, Carrie is somewhere. Communications person. Rebecca, I think, was in the back last time I saw her. Our new environmental health. Who else? Forgot everybody. And of course, our new executive director, Val, yay! And I am the research director and the chair, New Mexico manager. So we would like to thank our board members. We have, starting actually with Sharon Finarelli, I'd like to recognize Sharon. Starting with Sharon Finarelli, she took it upon herself to really revitalize our board. And I think you'll see when you see the number of new board members coming on that is exactly what's happened. But first of all, kudos to our existing board members, some of who are just going to be here for a minute and a half left, like Lauren. Lauren Reichelt, Enrique Cardiel, who I know is here. Ursula, I believe, Enrique, Ursula's online. John, don't know if John's here. Letitia, don't believe she's here. Troy, Marianne, of course, you know now. Chris is here somewhere in the house.
Behind you.
Oh, behind it, yeah, Chris, okay. Jenny, Adame, and we always have to mention Ron Hale, who is a member emeritus. Ron has been with us for like 15 years. If you'd like to get a hold of Ron, listen on Saturday mornings to his folk roots radio show. Okay, that's our current board now, but look at our new members. New members, look at all, there are 2 slides, so hang on here. Debbie Ortiz is our new co-chair with Chris. And then Grant County, Marion Alcorn. Marion, Marilyn, are you here? Or is she on? Marilyn has been holding down Grant County for the longest time. Southwest. Felipe Chino, I said that right?
Yes.
Henning County. Joseph Hill is in Silver City. He's statewide though, representing statewide. Ken, I know is here. Ken from Oaks Tribal, Center, Pueblo.
Behind you.
Oh, Ken.
Over here.
Ken, yes, okay. And Shannon Barnes from Valencia County. I think Shannon's here. There's a bunch from Valencia County walked in.
I'm online. Hi.
Yep, from Vivo, yes. Isn't this terrific? I mean, we have a great new board. They're all energized, ready to go, and they're waiting to hear from all of you. So they represent you, they represent us. So let's get in touch with them. We'll have all of their contact information on our website, if not now, soon, right? Okay. Oh, wait, I want to say one more thing about, I forgot. We have 6 interns working with us. 2 of them are here. Carlene, who is somewhere in the back, way back there. Carlene is with, most of them are from New Mexico Highlands. I think 3 are MSWs from New Mexico Highlands. 4. 2 are from NMSU. Monica is now being, but Monica is one of the share team. Thank you, Monica. And, who's our last guy? Oh, Simeon is from NMSU. He's actually in Brooklyn, New York, finishing his MSW online. But we have a couple people we're very sad to say are leaving us. And the first one, slide. Ursula Bowe. Ursula has been helping us for the longest time. And she has a couple of people who would like to say a few words about her. Are they online or? I think, Kayla, you're gonna lead your team, right? Okay.
Good morning.
Good morning.
Good morning, everyone online. I'm Kayla Blanchard. I'm the Health Equity Promotion Liaison for Otero County Community Health Council. And to kick off this tribute, I'm going to refer to my colleagues online, Holly Mata, who is our Health Council President, and Maureen Schmittel, who is our Health Promotion Specialist from New Mexico Department of Health. So they're going to share some of their experience working with Ursula, and then I will close this out. So Holly, if you can unmute at this time, and then Maureen, if you could follow her.
Good morning, everyone. Thank you so much. And thank you, Kayla. Yes, Ursula, what a joy it has been to work with you, from our Culture of Health collaboration to our Civic Health Fellowship and everything in between. We have loved learning with you, growing with you, and advocating with you. Sometimes in life, we're lucky enough to cross paths with people in ways that shape our journeys long beyond our work together. You've inspired us and connected us in so many ways, Ursula. So this is not goodbye. This is thank you. We love you, and we're so excited for you. Thank you, Ursula, and I'll turn it over to Maureen.
Thank you. Good morning. That was beautiful, Holly. Hard to follow. And I just have to say, I have been so honored to work with Ursula the past couple of years. She is an amazing person, an all-around beautiful person. I've come to know her as a friend as well as a colleague. She is just great at anticipating needs of our health council, filling those needs, like recognizing things that will help and get us more organized. She's just been amazing. She's professional, she's dedicated, she's intuitive, she's creative, cheerful, detail-oriented. It's been such a wonderful honor and privilege to work with Ursula. And I know that she will be a true asset, you know, she's moving on to a full-time position in her home community now, and she'll be a true asset to them. But I do believe in my heart that we'll stay in touch. And, you know, although she hasn't been with us here in New Mexico this last year, she's really been here in spirit and put all of her heart into her work. And just thank you so much.
Thank you, Holly. Thank you, Maureen. And I must echo my colleagues' sentiments about Ursula. So I just have a few words I'd like to share. So dedicated, sharp, resourceful, and intelligent are some of the characteristics I would use to describe Ursula Bowe. Ursula has a special place in my heart because she was the one who trained me and guided me through this position. As a novice in the public health field, Ursula's unwavering support and guidance has been instrumental in the work that I do every single day. And Ursula has been the backbone of this health council by keeping us organized and informed on all the initiatives and projects that we do. And even though I am sad to see her go, I am blessed to witness her begin this new chapter in her life and in her career. As a community health educator, I know that Ursula will make an impact in anything that she does. So Ursula, thank you for being my confidant, my brainstorming partner, my teammate. I have grown professionally and personally since working with you, Ursula. You have set the bar and you have set the tone for the type of professional I strive to be. So thank you so much for everything and good luck. Thank you.
Thank you, Ursula, and thank all of you who are going to pick up where Ursula left off. Our next person probably doesn't need an introduction, but I'm going to talk about her anyway. Lauren Reichelt. My goodness, where's Lauren? Lauren, I was talking about Lauren. I mean, Lauren. Yeah, Lauren. Has been in the health council for how many years, Lauren?
Since the Pleistocene era?
Since the Pleistocene era, I think that translates at least 20 years. I'm pretty sure it's at least 30 years. Has been thick and thin. She's stuck with us. She's contributed so much to the Health Council. She's moving on now to a new position with the Environmental Department to pursue her passion on environment and public health. Didn't you tell me you're right across the hall from DOH and you're going to make frequent visits, reminding them?
I have done it.
Yes. So we have some people who would like to say some special words about Lauren, and I think we're starting with Anne.
Thank you so much. Lauren, would you just come right around here and join us? Yeah. And we can clap. Well, and we have three of us, and I believe that Amy Sandoval, if you're on Zoom, and then we are going to wrap it up with your colleague, who probably knows a whole lot about what you've done on the board, Chris. So, Lauren, I've known you for a long time.
Since the Pleistocene
Since
era.
the Pleistocene. And what has been amazing is your vision for health councils. Decades ago, you had a dream that health councils could and should be the voice of our communities collectively to the legislature. And you have carried that vision forward for at least 30 years. Thank you. You have also been able to focus on leveraging and have done that for many, many years. And we realize that our health councils leverage. And Victoria Sanchez and Ron Hale, who is such a wonderful guiding light, and I all developed work that came to the same conclusion. And what is that? Health councils leverage on a 4-to-1 basis, as long as there's core recurring funding. You have been a champion for that. You've been a champion for public policy that supports health councils. And the other thing is you stuck with it during COVID when everything just was not the same. And so for your many, many years of commitment and vision, thank you so much.
Oh, thank you.
Yeah. And then other folks that have things to share. Amy Sandoval, are you on the Zoom?
Yeah, I'm here, Anne. Hi, Lauren. Good morning, everyone. My name is Amy Sandoval, and I am the Northeast Region Health Promotion Program Manager with the New Mexico Department of Health. I came into the health promotion program at a time when New Mexico health councils were continuing to fight the good fight after funding was withdrawn from the legislature. And as the sole health promotion team member who was hired on, I was tasked with reconnecting with health councils across the region and offering technical assistance and support in preparation for funding to be reinstated to health councils in 2013. In the fall of 2012, our team had grown by one more, and myself and Krista Hernandez attended our first New Mexico Alliance of Health Councils meeting at the Luna Community College in Las Vegas, New Mexico, with Ron Hale and Marcia McMurray Avila. Representing the Department of Health at a time when health councils had been defunded, I was sensitive to the fact that I may not be one of their favorite partners to work with, and that made me all the more nervous. As the meeting started, a woman with purple and turquoise curly hair walked in front of the room and found a comfy chair front and center. As she sat down and plugged in her Mac computer, she kicked off her shoes and wiggled her toes. She caught my eye because of the beautiful peacock feathers in her hair and her gentle and fervent spirit to the conversation being had in the moment. I thought, wow, who is this person? And I was intrigued. That day, I came to know this kind and beautiful soul as Lauren Reichelt. She was the executive director of the Rio Arriba Health and Human Services Department and the Rio Arriba County Health Council coordinator. In fact, she led a grassroots effort in the early 90s to establish the Health Council within Rio Arriba. Lauren's approach was far different than anything I had heard of before. She did not envision a build it and they will come mentality, but a build it with them so they could come mentality. Lauren spent countless hours and days meeting with community members, not in meetings, but in their homes to discuss local issues that they were facing and how to improve the community they lived in. I recall her telling me that people welcomed her and baby Benjamin with open arms as they talked about rebuilding playgrounds as they passed baby Ben around the table, engaging with one another. Those conversations led to other health-related issues, specifically the growing opioid epidemic and the grassroots efforts in search of solutions, marked by the inception of the first county-run Health and Human Services Department in the state of New Mexico in 1997. Over the years, Lauren's leadership in Rio Arriba County has improved the systems that residents interact in and support numerous initiatives to flourish, making this county rank highest amongst other New Mexico counties, like increasing immunization rates for elders by over 5,000% in 3 months through health fairs at local senior centers, benefits enrollment centers, personal care and home and adult daycares. In 2021, Rio Arriba County also had a 91% success rate of Rio Arriba County residents having received at least one COVID vaccination with the rollout of Pfizer and Moderna. These are just a few examples that don't quite touch the tip of the iceberg in terms of the accomplishment the Rio Arriba Health Council has delivered under Lauren's leadership, but it showcases the significant difference the role of a great leader can make over time. Lauren's passion and desire to make differences was always at the heart of the Health Council initiatives. She has always been someone residents look forward to engaging with and feeling valued in terms of their contributions. She is someone I have always admired and appreciated working with. Although this chapter is closing, I know this is not the end of your work with health councils in New Mexico. We are all so lucky to have you as the director of the Environmental Health Division and look forward to seeing you excel in this role, benefiting all of New Mexicans. Lauren, thank you for your tenure serving as the Rio Arriba Health Council Coordinator and on the board of New Mexico Alliance of Health Councils. Thank you.
Okay. Chris is going to take us home.
Okay, wow, I don't know how I'm gonna follow that, Amy. Thank you so much for all of those great words. And Lauren, we just want to thank you as well and appreciate you for all that you've done and the legacy that you're leaving behind. It's something really grand to leave behind, you know, almost a decade, almost 30 years, 3 decades worth of work. But we know that you're leaving also behind a a continued legacy, because, when we met, I was brand new, a very fresh coordinator, not knowing what anything of this was about. Terry Rodriguez had just introduced me to a bunch of the board members, including yourself and Ron and others, and I was nervous, and she was trying to get me to join the board, because we're always looking for board members, we're always needing board members. But I was very nervous and I didn't know what to do, and I was getting on my feet, and I feel like you were one of those mentors in the beginning, to really show the way of a way that boards can operate and really work with their communities and work with our health councils to really kind of get at that grassroots effort to really help with health. And I really have learned a lot from you too as well, and in adversity as well too. I remember for a time there, you were dealing with some health issues and you were still coming to meetings. This woman was getting chemo and stuff, and she was still coming to health council and board meetings to make sure that things were still running and making sure that, we were getting properly cared for. And that, we were really working for the health of all New Mexicans, even when one of our most favorite was going through a lot too as well. But you're here now today and you're doing really, really well, and you're going into the environmental department and you're leaving such a great legacy behind. And we're really looking forward to continuing that on in your honor and in all of the work that you've done. So we just want to thank you so much.
Thank you.
Before you start talking, we're gonna give you plenty of time to talk, Lauren, but we just want to let you know that we have a special little gift for you. It says, Lauren Reichelt, thank you for your dedication and leadership for advancing health equity across New Mexico and for your support for New Mexico Alliance of Health Councils. And there is a backstory to the design of this mug, which Carrie will be glad to tell you about at lunch. But in the meantime, this is for you, Lauren.
Thank you. I drink lots of coffee.
And this is for you, Lauren.
Thank you so much. Oh, you are so sweet.
And now the mic is yours.
Oh, thank you. Well, I'll try not to talk your ears off. First of all, thank you so much for that generous send-off. And I do plan to stick around as the past chair to offer assistance whenever you guys need it.
And we will need it.
And I'm just so moved, and thank you, Amy, thank you, Chris, thank you, Anne, and thank you, Wendy, and everybody. Yes, I first started with health councils, I think in around 1994. So it's just been forever, and I'm only half joking when I say since the Pleistocene era. And for those of you who don't know, in late October, I left my position after almost 30 years with Rio Riva to become the division director for the Environmental Health Division of the New Mexico Environment Department. It's the largest division, I believe, in NMED, and we have 26 field offices. And after the session, I will be traveling around to every single one of those field offices to introduce my staff there to the health councils and the county managers and whatever mayors of municipalities there might be to talk about collaboration. Something that I would really like to see, and I have been working with really closely with Department of Health and with Department of Health EPI team, is for us to begin including in all of the health profiles what's called a health impact statement for environmental issues. And this is both for climate change, but other environmental issues as well. So the Environment Department is organized differently from DOH, and it's primarily a regulatory agency. We show up usually in a community after something terrible has happened. And by then the whole community's all mad at us and has never met us before. And so my philosophy is it takes $15 to $50 million to clean up a Superfund site, as we in Espanola know very well. It takes 3,000 probably to prevent one in the first place. And so I'd really like to see NMED shifting to think about what does prevention mean in an environmental context. And that is what we need those health assessments as part of the health profile for. Rather than having us try and get like millions of dollars out of the legislature to hire a bunch of outreach staff, I'd rather see us push for funding of health councils and to partner with health councils and to provide you with technical assistance to do those impact statements. Right now, there's no funding to do it, so I'm looking for grant funding. One of the things that the Environment Department and probably all of my friends at the DOH are familiar with this phenomenon too, is there's not a continuous grant funding cycle like we had in Rio Arriba County. I had a matrix where I knew every single staff person, what grant they were coming out of and when it ended, so I could make sure we found funding for them. NMED does not have that. We'll like start up a great new program where we have 10 staff and then it ends when the grant ends. So I'd like to work on setting up a continuous grant cycle to fund things like collaboration with health councils and those health impact assessments. I also was approached by University of California, and this was this weekend, and this is a really great opportunity for the Alliance and for health councils. They have started up a project to map in California every hotspot for climate change in order to work with those communities to try and promote resiliency. There's no greater health equity issue in the midterm future than climate change. And they asked if New Mexico would like to be a partner with that. And I said I had to run it up my chain of command, but I was about 98% sure that the answer is yes, why wouldn't we? And so that would bring significant, at least human resources to bear and educational resources on how we can map our own hotspots too. For the Environment Department, I'm looking at working with DOH EPI to map things like, where's every single septic tank in New Mexico? Where do they coincide with sewers that we could connect to? Where do they coincide with water that is contaminated by septic tanks? So I'd like to see us do a lot more GIS mapping to help fix environmental issues. We're going to be creating an indigent fund for people who need to fix their septic tanks. It's only going to be $1.3 million, which could be out the door in 10 minutes. But I'm working with DOH on those maps of septic tanks so that we can figure out where we can target that money, plus where we can look at our $51 million that is a recurring fund from the Construction Bureau to build sewers where they would do the most good and probably eliminate the most septic tanks. So those are some of the kinds of things I'm working on in my new position. We're working currently with Susan Wilger, who most of you know. We selected an EPA grant, and the EPA grant is for health impact assessments on air quality. And I'll be approaching Chris because we want to work with McKinley County and with your health, or not with McKinley, with San Juan and with the health council there. I'm looking at how we can mitigate air quality or air pollution caused by oil companies. And I'm also going to be reviving a grant that was written and then never submitted by NMED to train community health workers to work with communities on environmental impact statements. And I'm working with the team at UNM and DOH to do that. And so those are just some of the grant opportunities that we are going to be looking at. I'll of course work really closely with the Alliance. And I have one last ask of you. One of my fellow division directors grabbed me as I was walking out the door. There is a bill, and this is, I'm asking you not on behalf of the Alliance, but on behalf of the Environment Department. It is House Bill 426, Clean Transportation Fuel Standards. There are currently no health advocates that are lining up for this. It could make or break the bill. And it's really important in terms of really preventing pollution from being poured into our air that's going to cause childhood asthma, et cetera, et cetera. It is coming before the House Energy and Natural Resources Committee either tomorrow or Thursday. And we would really, really appreciate it if those of you who are around for Public Health Day could go support it or talk to your legislators. That's House Bill 426. And if you have questions, you can call Michelle Miano at, are your pens out? 505-479-2596. So that's 505-479-2596. Even if only a few of you could come out and help us on that, it would make a huge difference. And we behind the scenes are doing what we can to help support the bill for funding for health councils, letting any legislator who will listen know that health councils don't just help the public and the Department of Health, but they're going to be critical to the Environment Department too. Thank you.
Sorry, I went so long. You didn't go long enough as far as I'm concerned. Okay, so. Right? I mean, 30 years of service. 30 years of dedication. 30 years of raising the bar, then setting the bar, then raising the bar again, lowering the bar. Because when the pandemic came and all of a sudden we were all like Richard Simmons or doing those home workouts. Walmart, there was not a single weight to be found. And then if you did find them, they were like $20 for 1 pound. I'm like, who's creating these prices? Like what happened with that? Since when did everybody get healthy? And then we all start reemerging. And then the health councils are all like, all right, project coordinators, now get out there in the public. We need some vaccine equity. We need to start getting folks vaccinated. And we need to make sure that folks know where to go to get vaccinated. And then it was like, you could go outside, but you got to stay 6 feet away. So you're across the street and you're like, hey, are you guys vaccinated? What's going on over there? You want to see me about some vaccinations? Because I could talk to you about vaccinations all day long. And they're like closing their blinds. They're like crazy girl outside. We all have been there. We have all had opportunities where our health council is like, well, okay, let's just put it on the table. Have you seen what Rio Arriba is doing and how successful they are? I know that I had that conversation with my health council. I was like, why can't I be like Rio Arriba? Why can't I be like Chavez County? Why can't I be like all these other counties where everyone is so happy and you see everyone on Zoom and everyone is like rainbows and sunshine, and I'm sitting there and I'm like, I'm brand new to this. I have 185,000 residents. I went a little bit off book from my health council and went on my own speaking tour before I knew that we were supposed to go on a speaking tour. And so they were like, Mary Ann, you're a little unorthodox in your approach. Well, hi, I must have said like 19 times in my 4 interviews that I was Sicilian and a transplant from Brooklyn, New York. So of course I'm a little different. Like I'm in New Mexico. It's fun. Like everybody has like this amazing type of effortless ease into each moment of each day and everything that we have to do as health councils about the vaccine equity, the community rebuilding, the restructuring and rebuilding of communities, whether or not the Kellogg grant is going to get refunded, whether or not folks that were employed under the Kellogg grant are going to maintain their position or not. And then what do we do after the world stops being aware that we're still in a pandemic? COVID is still taking lives. If you don't believe that, then you are not checking out Facebook, because I know of one family in particular, a 32-year-old school teacher who was scheduled to get her vaccination the following week, contracted COVID and passed away. It was devastating. She was the sister of a very, very, very close friend of mine. And when I say that, I was like, what the hell happened? When did the world stop realizing that we're still in a pandemic? So when I look at the things that we are doing as health councils and the New Mexico Alliance, we are all fighting this fight together. And I know that I have said in different Zooms that as a project coordinator, I am more than happy to come to your county and to walk with you and to work with you and to help strategize on what we can do as project coordinators. This also goes for everybody on Zoom. I am more than happy to see how we can come together and we can create a solution that's going to benefit all counties. Because even though I represent Sandoval County, I'm also have neighboring counties, and I shop in other counties and I play in other counties and I go on little, weekend trips in other counties. And I feel like I'm not doing a service in my position unless I'm making myself available to you in whatever capacity. If you just want somebody to vent to, if you feel like you are hitting a wall and you don't know, you're not making any traction and you're not getting any movement on the work that you are being asked to do. As project coordinators, as health councils, we should be able to speak openly and freely with one another. We should also create an opportunity for one another to speak safely without the fear of, oh my gosh, did you hear what Mary Ann said? She said that her job description changed 19 times. Girl, this is a pandemic. And of course it's going to change 19 times because the world just keeps changing. So here's what we should be doing right now. On my little program, it says that I'm supposed to be giving you directions to a restaurant that we're going to be going to in about a half an hour. I'm not going to do that. Wendy's putting up the little sign, this and that, and I'm ignoring her. It's what I do. Welcome to Sandoval County. So what I want to know is, I see all of your faces, and I will make eye contact with every single one of you because it is uncomfortable. And all these beautiful people over here, I see you, and you took that really cute picture, all of you together. I will take that picture for you. You should not have to selfie that. So I want to know, as health councils, do you guys have anything you want to share? Do you have updates? Do you have challenges? Do you have things that are just on your last nerve and you need somebody to hear you? Because I know that Zoom after Zoom after Zoom, Lord help me, I cannot put that meme up any more than I already have, which I think has already been like 75 times. And my boss is like, Mary Ann, I really need you to stop trying to share screen with the meme that says, this movie is boring. And the boss says, it's not a movie, it's a Zoom. It's still boring. So who wants to be the first to come up here and just share about what you're going through? If you have any positive changes that you've made, if you have taken the initiative to go on a walking tour, if you have done something that has impacted community rebuilding, if you have made good friends with, our fine folks from like Blue Cross Blue Shield or UNM or Presbyterian, or, not all everybody got to bum rush me at once. Who's coming up? All right. I know what to do. I'm a project coordinator. This is what we do. I'm coming to you. I'm just gonna come like, I don't know, Oprah. Have mercy. You guys hit the lottery with beautiful staff. Here we go. Where are you from?
County.
Rita Joe? Girl, you are my favorite vacation spot. I own timeshare with you. Oh, yes.
Our health council has agreed to encourage the idea of ditching the one-use plastic. And so at our events, at our community functions, we are giving out water bottles and encouraging people to refill because we know that the environment is an important component to our health and we must take care of it. And that's exciting.
Oh my God. That's so exciting. So if we are not at one of your events, how can we get one of those water bottles to support you?
Well, I brought a few today, so just let me know. And we can give them to our legislators and encourage the practice wherever we go.
Okay, by show of hands, who wants one of these water bottles? Okay, I'm gonna need two just so we're clear, you know. All right, I'm coming over here. God, Lee, you are absolutely stunning. Pamela Skinner, Lord have mercy, setting some standards here.
Good morning. I am Pamela Skinner. I am with the Community Wellness Council in Valencia. We are the health council over there. I am relatively new to the program, so I can't take full credit for what I'm about to announce, but we have established and released a online resource directory through all of Valencia County that I pitch everywhere I go. And we have little business cards about this big. We have provided to the police departments, sheriff's department, of course, all the local police departments, the school officers that monitor the schools. And it's totally online. They can use it on their phone. And it's simple for anybody to use. So that's my news.
Okay. Not like anybody wants to follow that up, but I mean, we're just gonna come on down here. Look at you, cutie dimples. My goodness. What's your name and where are you from?
Debbie Ortiz from Colfax County.
Oh my gosh, Colfax in there. So tell us about what's going on for you in Colfax County.
Well, one of the things we were able to do with the CALA CTC grant is we were able to secure over 400 tests. And we also have a home visiting program. So we were able to go throughout Colfax and Union County and able to disseminate those to our clients, but also other people, other agencies, other people. So that was one of the
So you got these at-home test kits.
we work with the Colfax County Emergency Management people.
And you take these tests and you like went into neighborhoods and you were like, what up? You might have a fever, have one of these.
Gave them to all of, yes, well, we go into the homes with our home visiting and we were still doing that. If it was safe. We had protocol and so we would give them to our clients and we give them to the clients for their families, give them to them for friends, go into businesses, offer them up to them. So we would hit, all the little towns.
So Debbie Ortiz.
A different Debbie Ortiz.
Okay,
There's
so
another one.
Debbie Ortiz, Colfax County. If we want to know how to create this for our health council, who can we talk to at Colfax County to create an in-home type of visiting situation like you have? Are these volunteers? Are they medical professionals? Who are these people that are going into their homes? And more importantly, are they getting fresh homemade tortillas? I need to know these things.
Sometimes, yes. Actually, we have a home visiting grant. So to New Mexico Early Childhood Education and Early Childhood Care and Education program. And so we have grants and right now we have 4 staff, but we need 1 more. So we're hiring if anybody wants to come to Colfax and knows anything about early childhood.
So early childhood folks, Colfax County. It looks like Val's looking for a second job.
No, partnership, I'm happy.
Oh, Val wants some partnership, should be discussing this at lunch. Anyone on this row? Shay on Zoom, oh, Shay, come through.
Hello, everybody. My name is Shay Yantis. I'm with Catron County Health Council. I'm the coordinator. We've actually been able to have our newsletter that has been steady and going out to everyone in our community. And we've had an amazing opportunity recently to build our capacity in our northern communities through that with multiple nurses and doctors, as well as our Kamado EMS and a fantastic relationship with Presbyterian Medical Services.
Shay, that's absolutely amazing. So how much work do you think went into that?
A lot of boot on the ground work. I'm actually in Kamado right now, although I live in reserves. So I'm 78 miles from home right now. And I was handing out our binders to our new members up here.
That's amazing. And so did you take part in creating this newsletter?
Yes.
And do you have graphics and pictures, real life pictures of real folks? Did you use a specific platform? I'm just asking because I think that there are lots of folks that would like to create a newsletter for their health council. And I think that if you could offer any kind of information as to what was successful for you, that would be amazing.
We have actually contracted through a company that we send our information into, and they create it and mail it out for us. And our most recent one was mini graphics for statistics to really just inform the community of what our problems are, because we are so spread out. There is a lack of knowledge.
Right, we're definitely seeing that. Well, thank you so much, Shay, for sharing that. Okay, don't think I forgot about this row. Oh, why do you have to make direct eye contact with that beautiful smile? You know I'm coming straight to you. Mhm. What's your name and where are you from?
Hi, my name is Janice Herrera. I'm a health promotion specialist with the Health Equity Council in Bernalillo County, representing Albuquerque.
Albuquerque and the house, everybody. So would you like to share something amazing that's going on for you besides that fabulous neck warmer? Thank you.
I would say a success for this year has been our Narcan distribution program. So we've been distributing through the SOURCE program in 2023. And so far have gotten out, I would estimate, about 150 kits, each containing 2 units to other service providers, government agencies, and even just to individuals as we go out and do some of the used syringe pickups in the community.
That's really amazing. So what a lot of folks don't know is that we also have a representative here today from the Albuquerque Street Connect. It's ABQ Street Connect. The executive director, Jody Jepson, she created a program, a model that has a lot of these components that you have just discussed. So I am going to point her out to you. Oh,
Right behind.
here she is. So the two of you should definitely have a conversation because her program is absolutely changing lives. And that component with her component is nothing but positive change. And even though ABQ Street Connect is currently in Albuquerque, she is planning on taking it statewide. So anyone who's interested in having a conversation with her about how to get her model in your area for your homeless and your folks that have housing insecurity, food insecurity, clothing insecurity, behavioral health, this is the person that you need to speak to. So everybody just take a good look at that face, hunt her down. She's all about it. I didn't drag her all the way down here for nothing. All right. Okay, so here we go. We're going to this restaurant. It's about not even a 5-minute walk. If you have on heels, you might want to put on some sneakers. I think it's still a little bit wet, maybe a little snowy in some spots. Do we know the name of the restaurant?
Rio Chama.
Real trauma.
Walk out and turn right, and there's a sign, it's not huge, but there is a sign right there in the building that says Rio Trauma.
So lunch is at 12 o'clock,
But you go anytime.
but you can gather your belongings. But all board members, you may not go to lunch before you get this picture.
Yeah.
Monica will be tackling you. I will be watching, holding up scorecards.
Okay.
And so we will meet you at the restaurant. And then when we get back, we're going to be discussing this back row of beautiful people. All right. Thank you, everyone, for your time.
Main reasons why I'm here. It's because I just wanted to come and share just a few minutes with you and say how proud we are of you and the work that you are doing, but also, so thankful of the partnership that we have with the New Mexico Alliance of Health Councils, with the health councils, with hospitals too, as we're trying to strengthen the way in which we do assessments and improvement plans in New Mexico, right? So really, the first one is a big thank you. You don't really know how much we appreciate you, and we don't say it as often as we should be saying it. So, thank you for that. The second one is actually I had an exercise that I want to do with you guys because I don't want to be talking here all the time. And I think here it is. It seems that you all have these sticky notes in your bags. You also have a pen. Right, so we're going to do a little bit of an interactive exercise here, so that we will be able to shout all the way. Enrique is going to be able to yell from there, hopefully, right, Enrique? Like we got it there. So let's pick this up, and I have one question for you. Let me set it up though. So over the past year and a half that we have been working. In the context of the health disparities grant, right? In the context of trying to improve the system in how we do assessments, how do we improve collaborations at the county level, at all, and try to ensure that health councils can serve as this planning body that can communicate the voice of the community to the different parts of the system, right? Like county executives and MDOH, like hospitals. And so forth. As we have been trying to do this work for the past year and a half, what does success means to you? We still have, and actually I won't share these yet, we'll have another update, but what does success looks like to you? Am I good?
Everyone put it in the chat too. If you.
So yes, I'm getting some advice here. So for those of you who are online, if you can share it in the chat, and maybe the question should be in the chat as well. What do you think success is? Take a minute, just to write it here, and then we're gonna be able to share it. Maybe we'll shout it from from where you are. But take a minute. What do you think success is? So we're gonna look back in whatever amount of time, 2 years, and we're gonna say, we did all this work, and this resulted in such and such, right? Like you are spending your time traveling to Santa Fe, you're spending your time going into meetings and trainings. What will we have achieved by the end of this process? Which to me is part of the continuation of the process, really, right? So let's take a minute, and I'm gonna check here.
I think what you have in the.
Take 1 minute still. There's no rush at the moment. I'm looking at the clock, so I do not extend too much. Yeah, it's important.
Some of the health commission.
Awesome. So we have about a minute now. Let's do this exercise.
This is not even,
Okay.
not worth it. We were trying to.
Can you
give
hear
it-
me if I just speak like this?
Okay, you're good.
I'm good.
I'm trying to give a mic to everyone else. This one, the other one's dead.
Okay. So sounds good. So who wants to share, like, raise your hand. Yes, go ahead and share your name too as well, so I can, yeah.
That would show that we gain knowledge and make connections that empower us and our work. And that would be seen through impacting legislation like Southern Health Council.
Awesome. So increase knowledge, increase skills to do your work as a health council. Excellent. Who else? Who else wants to shout? Enrique, yes, go ahead. And then I see another hand here.
Creating just jobs for social justice, community power, and health equity.
Wow, that's powerful, right? We're speaking about transformation here. Thanks, Enrique. And please remind me of your name. Pamela.
Setting and achieving goals that result in a healthy community.
Healthy communities, right? Like individuals who are healthy. Let's give a little bit to the people in the chat a chance. I don't know if you want to read just a couple of them. And before they are read, I just want to also thank the health promotion team from NMDOH who is joining us online via Zoom. We are in a pandemic, or we're about to end the emergency for a pandemic. The president will like it soon, right? But over the past 2 years, we were in a pandemic that really pulled us in the direction of addressing that. And the health promotion team not only had to deal with trying to ensure that we take a look at health councils in general, but also trying to work with like vaccine promotion, et cetera. So they have been stretched thin, and we recognize that. So I just want to make sure that we give thanks to them as well publicly, as that they join us online today. Okay, so let's hear some of the information in the chat.
Diana Good says, what you have and what the world needs. Iris Riano says, quality of services providing to communities. Maureen Schmidl says, New Mexico well-being measures improves no longer in the bottom 5. How about aiming for the top 25? Sergio Castro says, success to us means that we have impacted the social determinants of health in our community to the point where every member of our community has an equitable opportunity to access every help needed and has their needs met, not only to survive, but also to thrive as an individual and as a family. Mary Mackey says, when gaps are filled and whenever needed. Karen Sullivan says, a healthy and engaged community. Shady Antis, success looks like having a fully funded and well-known and developed council and mission bettering the health of our community as seen through our statistics. Jose Gonzalez, meeting your community's social and emotional needs. Nadine Hiron, making progress no matter how big or small. Veronica Espinoza, meeting people where they are. Pat Liahan, social, environmental, and economic justice is every one of our communities. Jessica says that there is a comprehensive CHNA process for each health council that is community-led and engages lived experience. And that this process helps build the chip, which then coordinates with the ship. It would illustrate that there is common threads among all of these processes.
Awesome. Thank you so much. Anyone, and a couple other people here that would like to share your thoughts as what does success mean? Yeah.
Margaret Thomas from Hidalgo County, community engagement, having effective strategies and increased proactivity and relationships for each time.
Thank you, Margaret. Absolutely, right? So impactful community engagement and selection of adequate evidence-based strategies. Great. Who else? One more person at least. We'll read them in a second, but let's see one more person here and then yes.
success is health equity across all counties and tribal areas.
Which means that it's not about the equal amount of resources, but the resources that are needed according to the needs of the community, right? Thank you so much. That's excellent. So let's read this, and then because of time, I'll just move on. Let's read a couple in the chat, and then I'll provide a few updates.
We have someone labeled as white, access to resources. Laura Jaramillo says, working together as a whole community to make impactful improvements. Lindsay saying, meeting our community's needs.
Thank you so much. So this is excellent because, I mean, given what you are trying to accomplish, I think actually we are in line with the whole process, right? Which is very important. We cannot lose a track of what we want to accomplish as a body. We have to keep that in our minds. So a couple of updates, and regarding to some of the things that you've shared. So just as a reminder, and Jessica was mentioning there, hopefully we can link the community health improvement plans to the state health improvement plan, right? Which that in itself is already a change of the system as we're trying to engage or include community voice into the state health improvement plan. So that process is actually ongoing at the moment, and we are very, I think, lucky to have Secretary Allen now with us, who is very interested in health equity and interested in continuing that conversation with communities and the integration of the state health improvement plan. So in a few months, when we look back, hopefully we will have, integrated community voice into the state health improvement plan, and we will have met them one goal at least, right? As another goal that you guys are talking about here is thinking about the system in general. What are the needs and how do we strengthen, right, the ability of health councils to do their work? So as we move forward into the following year, continuing to work on that, it's going to be truly important, right? We know that like through the Alliance, we have been working with Ann Egan on the trainings and Valeria now on the trainings and looking at what are the areas in your organization that needs to be improved. So how do we strengthen that structure as well? And how do we connect it to, for example, community health assessments are done also by hospitals, that to maintain their non-profit status, they actually have to do their community health assessments. How do we link the processes in an organized way? So actually tomorrow we have a meeting again with the hospitals just to continue that conversation as we are trying to align the cycles and then also ensure that they are communicating with you as well in the process, hopefully working together towards that. And then lastly, yes, the goal of the outcomes, which it's our North Star, ensuring that the population in New Mexico is healthier and happier, right? And that we can measure it in an effective way. So I'm glad that you guys are thinking in that direction, because as we work together, it's not about what NMDOH wants or what the Alliance wants, but it's really what you think about what are the important goals to achieve together, right? As a system, as a public health system. So a few last update is, as you know, a lot of this work has been funded by the CDC Health Disparities Grant. I just wanted to share that about 3.5 weeks ago now, we submitted a no-cost extension for this grant, which if approved, and we will know at least by the end of February, as we are told by the CDC, it means that we would have at least another $50,000 for each health council to continue the work until the following year. So some more funding to not only fund the work that you guys are doing, but also to think about the work that the Alliance is helping us do, technical assistance, and hopefully as well with our health promotion team as we think about the system overall. So those are good news in the sense of we were told by our officer that that seems to be very likely that the no-cost extension is going to be it's going to occur. And in that case, as soon as we know about it, we're just going to send that information to you so that we can celebrate together that we'll have some more funding for the following year. And then lastly, I just want to finish with this last thought for all of you. As we think about health equity, as we think about thinking about the system in general, I'm very happy to know that we are going to be reviewing today in the afternoon the results of some of the surveys that you have taken, right, in terms of organizational development and governance structure. As we think together about how do we get organized in or make some changes, hopefully you feel part of the process as well, because the information is coming from you, and those recommendations then like will help us to think more thoroughly as to what kind of like structures do we build, what kind of networks do we improve, so that like you can have the resources that you need to do the work that you need as health council. So thank you so much for all you do. I'm glad that we are in line with goals and what we want to achieve, and hopefully we'll continue doing this together. And my apologies for being in a podium. I really would prefer like a circle, but I know that the room is it's difficult in that sense. But thank you so much.
Was I wrong? I could listen to him talk all day long. It's just wonderful. Thank you so much. I will be passing this around. This is for all the folks. If you could just sign this. This is to see about getting more funding for health councils. So I will give it over to Kiana. A round of applause for Kiana.
Thank you. Hello, everyone. Welcome back to the afternoon segment of our statewide meeting. We hope that everyone is feeling energized from lunch and ready for a still pretty packed agenda for dynamic afternoons program. Thank you to Roberto, wherever he went, our friend and colleague, and the Department of Health team as well for your partnership, and then for joining us today. As you all know, concurrently right now, our House Bill 49 is being heard at the Roundhouse. And I just wanted to make a note for everyone here in case you decide to leave, that this statewide meeting is being recorded and can be shared to you at a later time if you decide that you would like to tune in or to comment at the legislative session today. But I'm going to be moving right along in our agenda, and I am very, very excited to share with you all today the results of the governance survey. So for those of you I haven't met, I am Gianna Clay-Keeney, and I am the new Public Health Program Coordinator for the Alliance. A lot of my background in public health has been pretty data-centric, so I was really excited that this is one of the first big projects that I took on when I started here at the Alliance. Since I've started, you have likely been really inundated with reminder emails from me or from the rest of the team to complete the survey about your health council's governance structure. But it was just really, really important to me to receive as many responses as possible, just to ensure that all your health councils and your communities are heard and represented in our advocacy efforts with the Department of Health and in our legislative efforts as well. As you may remember from the survey, we created this survey in partnership with the Department of Health to understand health council strengths, challenges, and areas of need, and had planned to use this information to improve how health councils are supported in this state. And so these answers were completely confidential, and no identifying information will be shared. And for any future uses, of course, we would request your permission. So all the information in this presentation here is aggregated. And so my plan is to go through the results first and the data of the survey, then discuss some preliminary recommendations we created based off of this data, and then we'll leave a little time at the end, hopefully, for health council comment and collaboration. So I have a very short amount of time, and so I'm going to go through the results pretty quickly to leave more time for the recommendation review and collaboration. And so because it's going to go very quickly, we are absolutely going to send you a copy of this portion of the presentation and links to the collaborative document I am going to bring up here in just a bit. And we plan to leave the collaborative period open for Health Council comment until next Tuesday, the 28th. So I am just going to, you're already there.
Yeah.
Thank you.
Go ahead.
So as you can see here, we
had a really, really big push at the end there and had a really high participation rate. We had 37 out of 42 health councils that participated in the governance survey. And actually I need this. And so to much of our surprise, the governance makeup type was mostly nonprofit and fiscally sponsored. Only about 12% of health councils that answered the survey were actually ran by a county or city government. And of these health councils that answered, 84% of them stated they had paid staff. And most of the staff said that they were really a combination of different funding and employment sources, some not funded by the CDC grant at all. So some may be partially funded by the tribe or other types of grants here. And so we inferred that those who answered no are mostly ran on a volunteer basis. And it looks like the average amount of health councils are about 2 staff members per health council. And each staff member works an average of about 27 to 28 hours per week. And each health council in total works about 40 hours per week. And then so in the survey, we then asked who is primarily responsible for several types of organizational tasks. And so there were a couple of choices, and you can answer both. So one is your health council responsible primarily for these tasks, or is it your sponsor, your fiscal sponsor, or county or tribal sponsor? And so the data really indicated here that health councils themselves are primarily responsible for their own organizational development and maintenance, even despite being sponsored. So the AR is accounts receivable. So who sends invoices to receive funds for the health council? And see, as you can see, 83% of health councils said that they do it themselves. Accounts payable is who directly pays vendors for purchases of goods and services. And if these health councils are sponsored, this makes a little bit more sense to me, that the sponsor might be more likely to make direct payment. And who is responsible for health council budget development, management, and monitoring? 71% of health councils said they themselves are. And this one I was a little bit surprised at, but 88% of health councils said that they are responsible for their own grant writing and other fundraising. And let's see, and who hires staff and are contractors to conduct the work of the health council? Health councils answered at 75%. And then who manages communication such as the health council website, social media posts, newspaper articles, and media radio appearances? And a vast majority of health councils manage that on their own. And so like I said, this was really interesting information. And this was one of our key parts in advocating for funding for health councils and HB 49. And so a next question we asked is if health councils have the following. And so these were a little bit all over the place, and there wasn't a lot of trends here, but I can go through each one with you. So really, really amazing to note that about 95% of health councils said that they do have regularly scheduled meetings. And a large portion of that, I think, is the monthly reporting requirements for the CDC DOH grant, which requires it. And then another question we asked is, does your health council have written and approved policies and procedures specific to the health council to guide its work? And, this isn't a requirement, but about 65% of health councils answered that they do. And our next question was, do you have an existing steering committee or like a core team or a board to guide the health council, and there's about 81% that answered yes. And so this one, the next one was made a little bit of sense, and so it asked if there are any active committees, which meet separately from the full health council, and that one was answered about 46%. And you know, for that one, that makes sense to us because of the capacity of smaller health councils, just because they're a lot smaller. They don't have any sort of active committees outside of their full health council, and so they usually address all of the different topics within the full health council. And so the last two are more so specific for nonprofits and fiscally sponsored health councils only. So this one is a really important data point for us here, which influenced a recommendation I'll discuss later. And it is, does your health council have a memorandum of understanding with the county or tribal government or a fiscal sponsor? And so overall, this question was answered yes at 31%, but I controlled for just nonprofits and fiscally sponsored. And it looks like only about 45% have some sort of existing official partnership with their local government, which is really surprising. And the last one is more so specific as well to nonprofits and fiscally sponsored. Do they have existing bylaws? So I controlled for nonprofits and fiscally sponsored as well. And of those, only about 66% have existing bylaws. We also asked other questions that I put on here was, is there an orientation guide for new members? About 40% overall said yes. And then are there existing job descriptions or scope of work for staff? And it was answered yes at about 63%. And so the next part of the survey, it's not moving. Thank you. Oh, no, that's not it. So the next part of the survey asks some questions about resource development and fiscal management. And one of the questions asked if the 2 Department of Health grants from the past couple of years were their main sources of revenue. And about 96% of health councils counted this as their main source of revenue. And for some, they're actually their sole source of revenue. And so the graph below is a graph about diversity of revenue streams on if other people have funds that are coming from outside of these 2 grants, where are they coming from? And so for state contracts, only 8 health councils have state contracts other than the 2 Department of Health ones listed, but 67% of other health councils do not have any other state contracts. 2 health councils have funding from their county, while 92% of health councils do not have any funds from their counties. 2 health councils stated they have funds from the legislative junior funds, and 92% said that they do not receive that funding. 2 health councils also stated they have federal contracts or grants, while 92% of other health councils said that they do not have any type of federal funding. One health council stated they had a foundational grant, and 96% of other health councils specified they did not. And 3 health councils listed that they have corporate sponsors, while 88% do not. I don't think my clicker is working. I think, nope. The wrong way, I think. Thank you. And so this question here, unfortunately, was not asked of all health councils. So in order to capture the last bit of health councils to answer this survey, we created a condensed version, and we added in this question as well. So it only captured, I think, about 12 answers of what is your approximate annual budget of your health council? And so, it's a pretty wide range, which is why I put the median there of 35,000, but it ranged from 12,000, the minimum from the CDC DOH funding, and all the way up to $1 million. Yeah. And then as far as other fiscal resources as well, we asked a question about leveraging other types of resources. So like bringing in new resources other than the funding sources identified, like office space, volunteers, non-cash contributions, donations, that allows health councils to grow or scale or be augmented. And so these were the top, that's okay. These are the top resources that I found in this open question. So a lot of health councils that are sponsored receive in-kind office space, which also provides utilities, conference rooms, and gyms. And then they have significant volunteer hours through their board members and community institutional partners, and then especially agency and provider volunteers was highlighted as well. Thank you. And so in the survey, we asked some open-ended questions and held interviews also with several health councils, asking about strengths, weaknesses, and additional comments. So these are some of the keywords that I captured out of these questions. The really, really interesting part, as you can see here, is that there is a lot of crossover actually between the strengths and weaknesses that were identified by each health council. And this particular aspect informed several recommendations that I am going to discuss. So you see here on the left side is strengths. So some of the biggest ones were highlighting agency partnerships. And then also because of their visibility, they've been able to gain community trust and have community engagement as well. And they felt that their health councils were pretty representative and diverse. And a pretty good highlight as well was the diversity and dedication of board members, some who have been have very long-standing relationships. And so as you see, some of the same things cross over to weaknesses here. And so stakeholder engagement and funding are probably the two most keywords that came out of here, and as well as the interviews as well. And we've known this for a long time, but it's really great to have data to back all of this up. And so, these are two key pieces in our recommendations down below. And so I'll explain to you on why the crossover between the two is really important here in the recommendations. Thank you. So we initially sought out to create the survey, like I said, to understand how the organizational structure of health councils inform operations, strengths, challenges, and areas of need, and how we can use this data to improve how the Alliance and the Department of Health can support you, improve your capacity, and give you the tools you need to serve your communities. So we came up with the 7 key recommendations that you see here. Training and technical assistance support, establishment of peer learning groups, support strengthening relationships between health councils and government. And so that's like tribal, county, city, resource development support, recruitment and human resources support, multi-program framework streamlining, and development of visualization tools for monitoring and evaluation. And so a vital priority is to ensure that initiatives to improve health councils are, of course, driven by health councils themselves. And so, we took a run at this and made inferences based on the data that was provided, but really would like to leave a comment period open for health councils to capture thoughts of these recommendations, make suggestions, changes, or even make additions if you feel like there is anything missing. So I want to open up the collaboration period now. Carrie. And so you can scan this with your phone. If you open your camera app, and then you can just point it to the QR code here. It should bring up a link. So I wanted to open up the collaboration period now, so that because we're so short on time here, that I want this to be open and have health councils a chance to really take an in-depth look at what I'm about to review with you all here, and to give some time for some thoughtful comments, and not to feel rushed right here that this is your only chance to have comments or suggestions for the recommendations. And so I'm going to go through each of the recommendations I just said a little bit more in detail. And as I'm doing that, you are welcome to begin adding your notes and comments on this application. Is called Padlet, which we'll show here in just a second. And as I discuss each one, and then also, as you see in the application, there on the bottom right side, there's a little plus sign. And so you can add an entirely new topic there as well. So this is what the collaboration document looks like online. It might look different on your phone. And so where it says add comment, you are welcome to add any thoughts, support, additions, and then you see the plus sign there. You can add any other topics here that you don't see discussed today. So as I'm discussing them, feel free to add comments, and I'm hoping we have time at the end to review some of them. And then also we can leave a comment for open mic in their room as well. This is only mic though, right? Okay, we'll figure that out. So I'm just going to dive right into the recommendations. Whenever you're ready, Carrie. So our first recommendation is to streamline and expand technical assistance support through the Department of Health and the Alliance. And we have several suggestions on how to improve this. And so, one of the key things I've learned, and starting with the Alliance and in reviewing the data and the governance survey, and also holding these interviews, is that every health council really has individual and specific needs. And, we saw it ourselves too, even in the governance type structure. There are a lot of topics that would not be germane to one health council, but very vital for another health council. And so one of our key suggestions is that we need to start individualizing trainings by into tracks by topics and governance type. And so when I say governance type, we may have different topics specifically for those who are fiscally sponsored. Like what if they would like to write their own bylaws? What if they would like to attain 501c3 status? What does that look like for them? And then also by topic as well, we think that it will be important to hold a series for some of the most requested topics. So like the stakeholder engagement process, that's probably our foremost requested area of need. And We had one training a couple months ago, but it's just, just sort of an overview. And as all of you know, the stakeholder engagement process is just a huge process. There's different segments to it, like mapping different types of stakeholder engagement. Like, are you trying to engage volunteers? Are you trying to engage board members or community participation? And then also, like, how do we retain stakeholders and keep them engaged? And then communications surrounding that. And so as we think about some of these areas of need, we realize that we need to be able to offer trainings that that break down these processes. And then our next most requested one is organizational development support. And so this includes stuff, like you said, like maybe assisting fiscally sponsored and 501c3 process, leadership development, creating bylaws or MOUs, even like accounting and grant management, human resources, and legal. There's in trying to support health councils and scaling up, there are just a lot of different aspects in organizational development, especially in those health councils that are just sort of reigniting themselves, and a lot of this is new to them. There are a lot of different aspects that need support. And so that is an idea we have for a series of trainings as well. And then also communications and navigating and using social media. It's so important for health councils and in stakeholder engagement to have visibility, to use communications to develop and maintain an identity, and to keep your community and stakeholders engaged. And the communications planning is a process in itself that has many different steps. And so we think that health councils can benefit from a series in that topic as well. And then also in developing tools and toolkits that could be helpful. And so as some of you may know, we are developing a resource library, and then we are thinking that we could restart some of your existing health council toolkits, and then also expanding or creating new ones as well, like the hiring toolkit, which I will also touch on again later. And then our last one here is more so on the Alliance and the Department of Health side, and this sort of defining our scope of what type of trainings that each entity will offer, and then defining our roles and responsibility, and that as well will help streamline the training process a lot better. So you are welcome to add comments if you are already doing that, and hopefully we'll have time to review them at the end. I'm just going to go on to the next topic, which is the establishment of peer learning groups for specialized topics. So I had said on the previous slide that it's important that we have individualized tracks, and a part of this as well, we think it would be really useful to have ongoing support as well. And as I had said before in the review of the little word clouds of the strengths and weaknesses of the open questions, there was a lot of crossover between them. And so this really showcased that, some health councils have strengths in some areas where other health councils need support. And it's been a pretty well-established tool that peer learning is really vital. And we have been experimenting with it a little bit in our capacity building trainings at the end of the month, and just have seen how like monumental it's been for health councils to learn from each other. And so because of this, we would like to propose the creation of peer learning groups. We have discussed this here and there, and I did in last month's communications training, but I'm really excited to present it officially here. And so our idea for this is, like you see here on this platform, which I'll discuss in a second, that we have individualized tracks and groups. And so we have been looking for platforms on how to deploy this. And this is just one example, but I am open to other platform recommendations as well. So this one is called Mighty Networks. And as you can see, I just created some mock groups. I have the tribal peer group, non-profit peer group, communications peer group, and we are hoping, that this will be individualized long-term support. And so as you see in this platform specifically, you can create events. So we can have trainings about something specific to the nonprofit group, and then host in here. Group members can chat with each other, and then we can also make a resource library in here as well. So, these are all still ideas, and we're definitely open to it. But, based on our experience with health councils and the data and the survey, we just think that this would be such a valuable and useful tool. And in one of the previous slides, I did say that only about 45% of non-county, non-tribal health councils have an existing MOU or official partnership with their county or city or tribal local governments. And it was in my informant interviews as well. It was probably one of the top things that were mentioned. As you all know, in HB 137 and the State Tribal Collaboration Act, the counties do have a legal responsibility in supporting, endorsing, and recognizing one health council in their county area. And it seems like it's been a frustrating road for health councils as they've been sort of trying to scale or reignite their efforts in the past couple years, is a lack of support from their local government. And so this is an area where we feel like as the Alliance and the Department of Health can help strengthen these relationships, and doing this by reminding them of their responsibility under HB 137, and then also from the Alliance, understanding how county government operates, identifying who the key decision makers are, and developing relationships and maintaining connections with them, which is in this statute. And once we can establish these relationships, we can discuss roles and responsibilities, and draft memorandum of understanding, so we can have more official partnerships with your local government, and provide other technical assistance like data sharing agreements and other guidelines, and formalizing expectations, standards, evaluations, and accountability. And so this is one recommendation that the Alliance thinks that we could be supportive on in the future. Let's see, and one of our biggest areas of need is funding. So in the open questions and interviews, when we talk about capacity, a big portion of low capacity has been the lack of funding, and also human resources, which is also tied into funding as well. And so in thinking about how we can be supportive at the Alliance in resource development, we came up with a few ideas and are open to others as well. But one is direct advocacy support from us, which is happening right now at the Roundhouse, and then also training for advocacy for government funds, which is happening right now. But then having more in-depth training on what that looks like for the future as we think about long-term sustainability for health councils. And also with developing a resource directory or toolkits, connecting health councils to grant research and writing services, you know, in capacity building. A lot of that has to do with funding, but if you don't have the capacity to even write grants, you know, then how can you attain that funding? And so we think that it would be really important to see if we can find those services, or if we can submit grant applications on behalf of health councils ourselves. And so this would look like applying for maybe federal grants where we are the lead applicant. And then we work in partnership. So this is it's supposed to be health councils. We work in partnerships with health councils. And so Wendy was back there, you know, with the team, just submitted a pretty big grant with NIH, right? The Community Health Equity Structure Intervention Initiative for $11 million over 10 years. And so we submitted that as a lead applicant with in collaboration with 4 health councils in Southwest New Mexico. And so that is one area of resource development. We think that we can be supportive of health councils in the future. And I have a couple more left. And so even with funding, it came to our attention too through these surveys that recruitment itself was also a bit of a challenge. You know, community health work is sort of a niche area still, especially in rural towns. And so there's some rural areas who do have the funding, but they've been struggling to hire community health workers or health council coordinators themselves. And so in brainstorming on how we can be supportive, we came up with a few things. And so one of them is potentially trying to work with the Department of Workforce Solutions for recruitment. So I previously worked with the New Mexico Environment Department, and we used DWS all the time. And we did even rapid hire events where we would hire like numerous people in one day, highly qualified people too. And so we think that there is an area of opportunity there. And also partnering with university, state, and community colleges as well for recruitment. So we do that already. We have, I think, about 6 interns through various MSW and MPH programs around the state. And so we think that's also an area of opportunity as well to assist with recruitment. And then also in this recruitment process, we do have an existing hiring kit, but we would like to refine that and update it. And then also maybe develop other tools as well for managing human resources. I have one more recommendation here. So this one is based off some of the survey data in the additional comments section, and also just some of our knowledge of health council work over the past couple of years. So based on what we've learned about health councils and data from this survey, we learned that there are various public health planning programs which require like different types of public health models and frameworks. And so for an example, I'm not sure if any of those health councils are here, but some health councils are part of the 100% community initiative, which requires an entirely different model and framework to operate. And so sometimes it seems like a little bit of a battle, because every single like funding source or program, you know, has different types of deliverables, and they have different types of processes that you go through, and it can be confusing. But we still want health councils to be able to leverage as much funding as possible and not feel like, you know, they might have to choose between funding sources. So one of our suggestions here is to brainstorm about like, how can we blend or braid and leverage all of these different types of funding together and, you know, and have them work together. And, you know, could that look like health councils having the autonomy to choose a different framework that is like most relevant to a specific program? Like say they want to use like DOH CDC funding for nutrition initiatives specifically, and then 100% community or other types of models for like behavioral health specifically. And you know, how can we ensure that, you know, we're working together and just streamlining all of these programs. I think, nope, I have one more. Sorry. Okay, so this last one is still very much in the suggestion idea phase. I don't know if Roberto is still here. He's gone. Okay. So this was proposed by the Department of Health to create an internal dashboard, which is going to be held at the Department of Health only because of capacity reasons, because they have an analytics team to host and maintain a dashboard. But so this would be an internal dashboard between health councils, Department of Health, their promotion managers, and then the Alliance. And still very much in the idea phase, like I said, but one of our evaluation experts at DOH made a pilot dashboard, as you see here. And they use all of this is mock data. As you can see, this is not even representative of the data today because I didn't provide her any of the data since it is confidential. And so they have a recommendation to have dashboards for different aspects of health council operations. And so, you know, this would be a tool to visualize governance structure data. So like the data that we have here today, or data collected from the community health assessments or health improvement plans as well. And so she has different tabs there, but I just chose the first one, which is just mock governance structure data. And so a big part of this, I don't think it was, I didn't put it on there, but a big part of this that I do want to mention is the importance that this is health council driven. You know, especially for tribes as well, data sovereignty and data sharing protections are really important. And I think that is going to be one of the key portions as we develop what this may look like. And so, like I said, this portion here definitely is going to be health council driven, and I am very, very interested in your feedback on this portion here. So as we move further with this idea, I think maybe in health council talks with the Department of Health, we will, you know, discuss what this program could look like in the future, with keeping in mind, you know, of course, data sovereignty and data permissions. But I just wanted to introduce this topic just a little bit for now, and to keep it on your radar in the next coming months as this is formulated. I think that's my last recommendation. So because we are short on time, I'm sure I am way over. I'm so sorry. So like I said, I wanted to choose, this is amazing. I want to choose a platform where we can collaborate really past this whole period. And we will absolutely send you the links to this right now, and also send a reminder to submit your comments by the 28th. Can you scroll down a little bit? We could also go to the webpage too. This is cool though. I was really proud of myself that I embedded this webpage into the slideshow. You had a question?
Yeah, is there any chance of extending that deadline from the 28th? Because I'm just thinking for our health council, it'd be good for them as a whole council.
Mm.
Look at those recommendations and give feedback.
Yeah, that is a
We meet
good.
once a month, and I think it's the first Thursday or something like that. So it could be before or after the 28th.
Okay, let me see. I'm sure, and a lot of health councils meet at the beginning of the month too. Let me think about that. I definitely will extend it. Maybe I will look at some of the monthly reports and just kind of gauge when everyone has their health council meetings, and then we'll send out a reminder in the newsletters on what that looks like. But I will definitely extend it past next Tuesday. Does anyone else have any comments or questions here in the audience? If not, I can. Sure, that makes sense. Okay, peer learning group sounds interesting. What would this entail?
Oh, we have a question.
Oh, great.
I just have a comment or maybe a question.
Mhm.
When you talk about governmental support, like whether it's from county or city, I mean, specifically when you quoted that one where the counties have to pay for, sponsor or support the health council,
Mhm.
is it limited to county or can it be city? Is it specific for just county government?
In HB 137, it does say county specific. Yeah, the county must, it's the county.
So it is county.
Mhm.
Okay. And then, so when you ask us to go to governments for support, we talk just like support of the council in general, we're not talking funding support, correct?
I mean, it could go either way because there's available funding within for the county for, health initiatives.
Even
And
if you're
so,
already a 501c3?
what's that?
Even if you're already a 501c3?
Sometimes, yeah.
Really?
Mhm.
Thank you.
Yeah. Okay. Yeah, I don't know if there's anything I could really address here. What aspect of government support should we concentrate on? Yeah, that's the same question you asked too. There is. It is, I guess that's the start of it though, is even identifying, who the key people are in these government structures and, how they influence health decisions within these communities and, understand how, they could use support and sometimes with that, comes funding as well. But, that doesn't have to be the only reason that we seek partnerships. There are a lot of county health departments that exist as well, and there may be some duplication of efforts that could definitely be sort of, I guess, accentuated or emboldened if we do it all together.
Thank you.
Mhm. Maybe I should. It's 2:28. They haven't got called yet.
Yeah, I was gonna give an update.
Oh, okay, no. So, since we're short of time, I wish I could sit here all day and look through all of these right now, but and first of all, I just wanted to thank everyone though for participating in this governance survey and sharing all of your experiences and time with us. We really hope that the survey and the interviews ensure that your communities are heard and will help us and the Department of Health develop a roadmap for advocacy and building tools and a support system for health councils for long-term sustainability and to just help you, keep doing what you're doing and serving your community. So thank you so much. We look forward to the future of health councils in the state.
Okay, so just a quick update. I heard from Val, they moved the committee meeting back to 2:45. So we haven't forgotten about you and told you to sit here and not talk about the committee meeting, but it is on the schedule. It's supposed to start at 2:45. Just by a quick show of hands, you could absolutely change your mind. But how many people here were hoping to head over to the committee room when it does happen? Okay, I just wanted to make sure there were people in the room that want to go and we weren't just sitting here waiting to call anybody there that didn't want to go. So I am on call. The plan is that as soon as they get queued to come up and present the bill, I'm gonna pretty much stop us in our tracks and let everybody know that they can head over to the Capitol for that. If you're feeling anxious and you just want to go, you're welcome to go now. It's really up to you. They'll do their whole presentation and then I believe, I don't know yet, sometimes they do the public comment right after you present the bill. Sometimes they hold it till the end. We won't know that until the meeting starts. So regardless, you would have enough time to get over there, but if you want to go at 2:45, you are more than welcome to. Our next, yes.
Question, what's the latest with, is it Senate Bill 2 or House Bill 2? I understand it's gone already.
Yeah.
Is that true?
Great question. I don't know the exact answer to that. I believe.
Wendy might have an answer.
Wendy? Okay. Yeah, yes, and if you go over, please wear your shirt. Also, did everybody get a shirt? The bright orange t-shirts outside.
Yeah, they're outside. And take a mask. We understand at least one person is COVID positive on that committee. HB2 left the House and went over to the Senate, and the recommendation for our funding for HB 149 is not in HB2. So the last chance we have is before the Senate Finance Committee. It won't hurt to talk to the Appropriations Committee today. I guess maybe there's still there will be some tinkering with HB2 because the Senate still has to provide their input to HB2. But as of this moment, HB2 does not include the funding recommended by HB 149. So we just have, I'm sorry, HB 49. So we just, one more chance, couple more chances. You had an action alert, I believe, this morning with the names of all the Senate Finance Committee people. That's our next stop is Senate Finance Committee so that they can get that money into HB2.
Okay. But yes, if you can wear the t-shirts, because then everybody in the room will be wearing bright orange. You can't miss us, right? Or a sticker, or both. What if I have both? Okay, Marianne, I think we're good.
All right.
Thank you.
It's a little more internet.
Okay, welcome back.
No, not yet.
Zoomies and people in the audience. And if you would like, and you are going over to that next meeting, if you would like to go and get your orange shirt and put it on and you know, get yourself geared up and ready to go, I will not take offense to it. I actually would like to spend a little bit of time talking to our folks on Zoom. I would like to know, let's start with you. For your health council, I would like to know, what are some of your challenges? What are some of the things that you have faced in the past 4 months? Let's say, let's go November to February. What are some of the things that you have found most challenging as far as this next initiative for the pandemic cycle that we're in? So we're doing community rebuilding. We are gathering all of our data and information for our chip. How are you doing? So let's talk to some of our folks on Zoom and let's see what you have to say, because it's very important. And I think that we should start right there. So feel free to put anything you want in the chat box and we will address it immediately.
Or unmute yourself.
You could also unmute yourself and you could just speak up. Oh, you all are so lucky that you're on Zoom, because I would so be coming over and sitting down next to you and saying, hey, let's have a conversation.
Good afternoon. This is Iris Rihanna.
And let's just see if they have
Can you hear me?
anything that they would like to share with us.
Look, can you hear me?
Yes, Iris, how are you?
I'm feeling a little bit better today. I was so looking forward to being there in person, then I got sick early this morning.
Oh, no, we were
Yeah, but
really
I'm,
looking forward to seeing you. How are
yeah,
you?
I don't
doing
want
now,
to,
though?
yeah, I don't want to miss it. So I'm on Zoom. I'm okay. But one thing is, for the past 3 years, ours was just even having a coalition meeting because of the community being closed and no visiting. That was our hardship of getting this program running because we were not able to meet as a group. And even if we did, not everybody was available. So that was our hardship and like some of the barriers that we couldn't get the program running. But now that a lot of the COVID stuff has really decreased, of course, we're still assisting, but now we're able to it feels like we're able to barely start where we're going. But thanks to the team, a lot of kudos to Geraldine, because she's really one of our person that, making sure that, we're being on track. So that's what was our hardship for Santo Domingo Pueblo.
So for Santo Domingo Pueblo, can you share with me and the rest of us something that was a success?
One of the successes, one of the new board members, Anthony Yepa has really been a good advocate. So, as he would say, everything he would translate for us to understand, even just the whole health council of Indianizing it and the translation of it, and just sharing this information out to our community, not only to our community, but our leadership and our coalition members. So, we've been having a little bit of problem kind of going back to the other barrier was sitting down as a group and reviewing our bylaws and roles and responsibilities. So that's some policies that, we've sat down and he's written for us. So it's that's really a big success, and we're finally going to have that meeting offsite. Thanks again to Geraldine, and she was able to get us a venue outside with one of her networking to sit down and review the policies of the whole health council, the roles and responsibilities of each member. So I feel that is a success finally, and but I'm grateful for that.
That's wonderful. So do you think that there's any benefit to maybe reaching out with your school systems, speaking to any of your educators or your superintendents, folks that are on the reservation, running the schools, maybe to get the vaccine or to see how we can help to rebuild on the Pueblos? Do you have that kind of opportunities? I'm not entirely sure how the system all works, but I think that the information would be beneficial for everyone to know, just so that we have a better understanding.
Yes, we our local elementary school is actually through the Bernalillo Public Schools. So there's also chain of commands we have to request. Of course, our leadership will also have to be supportive of that. We have made attempts to work actually with our local clinic to make sure that all the kids have the vaccines before they go back to school. And at that time, if any of the children had got COVID, they would refer them to us, and then we would refer them out for vaccine at our local clinic. However, like I said, we have to follow protocols just to make sure that we don't step on anybody's toes and just going in and doing all our vaccines. We all have to work together as well.
And you're in Bernalillo?
No, we're actually in Santo Domingo Pueblo, but our school system is through Bernalillo Public Schools.
Okay, so in Bernalillo, you have a facility, it's called the El Pueblo Health Clinic. Are you familiar with them? And they do
Yes.
phenomenal job of resources and vaccinations and healthcare and low cost and folks who are on the reservation. There's a lot of folks that they are not aware that El Pueblo Health Clinic has the ability and the capacity to do the vaccinations and the COVID tests and also for other healthcare needs. So anyone who is, because I believe all of that is Sandoval County. So you're absolutely more than welcome. And I know that the executive director of El Pueblo is Rick Adesso. He has compiled a phenomenal team and even recruited someone from UNM who decided to retire so that she could dedicate more of her legacy to helping folks who may not necessarily have access to quality healthcare at low cost, no cost types of situations. So definitely keep that in mind. And thank you so much, Iris. And I certainly hope that you feel better. If you need some at-home test kits or something like that, let us know because I am happy to make sure that you get them. And that's
Right.
for anyone else.
Thank you. I really appreciate it. I'm hoping to be up there tomorrow, but thank you for sharing that information. I believe somebody from El Pueblo did reach out to our program, and we had a discussion of that. But again, thank you, and it's good to see everybody. Thank you.
And you know, if you would like to help facilitate a mobile vaccination event, I would be more than happy to put you in touch with a person on the Health Council who can help to create a mobile vaccine event, and we can get it up and going in a matter of like 48 hours.
All right, great. That's good to know. Thank you again.
All right, take care.
And bye-bye.
Bye-bye. All right, let's see. We've got meeting your community's social and emotional needs. Absolutely, making progress no matter how big or small, definitely. Catron County has been struggling with DUI, law enforcement, and government involvement in the CHIP development process. Shay, would you like to expand on that, please?
We've sent out many invites, trying to bring in our local county sheriff, our different county commissioners, and our DUI coordinator to get their input. We were thankfully able to get quite a bit of input through Presbyterian and everybody else. But it has fallen repeatedly, unfortunately, on deaf ears, trying to get them in to at least get their input and opinion to further our development process.
Have you reached out to your local fire department and EMS, your fire chiefs? They, from what I understand, like the battalion chiefs, they really have taken such an active approach when the pandemic first started, Shay. They really were the ones who were boots on the ground, getting out there and really impacting communities in such a personal and hands-on kind of way that perhaps if you reached out to the EMS and the fire departments, they may be able to help you bring some of the police departments and the sheriff's departments come to the table, at least for a conversation with you. Have you tried that?
We have actually, we just recently developed a connection with Kamado EMS, and we have also discussed, and I've attended the volunteer fire department meeting for reserve. So have been really working with them and trying to encourage their interaction with us. Law enforcement has been one of the bigger struggles, and then of course DUI coordinator. And it causes us to duplicate a lot of work, I'm afraid, but I don't know for sure, unfortunately.
Sure. I know for myself, Sandoval County Health Council, working with the Corrales Fire Department has been just wonderful. They have taken such a hands-on approach. And so I know Quamato is so small. And you have lots of other areas that are equally small that perhaps if you maybe went and just knocked on the door at the firehouse and just said, you know what, I've got some struggles and I really need to try to find some solutions. And the New Mexico Alliance of Health Councils recommended that I come and have a conversation with you, and they would be willing to assist in this conversation and see perhaps if they may come to the table that way. And I can tell you that as the project coordinator for Sandoval County, I'm happy to connect you with fire department, EMS folks that we have here in Sandoval County, and they may be able to help you with an introduction, because sometimes, you know, you're inundated. These smaller communities are just inundated with requests, and the need can be tremendous. And the amount of hours that a person is working through this pandemic has been extraordinary. So if I can help you in any way, or the Alliance can help you in any way, please send an email. Rebecca will reach out to me, or you can, Kiana, any one of the Health Alliance folks. They are just, they're superheroes in my opinion, and have helped me tremendously as a project coordinator, because believe me, Sandoval County, like I have mentioned, 185,000 plus residents, and it is not easy knocking on those doors to these folks to say, hey, can we have a conversation? Because they look at me like, yeah, we're too busy. We don't have time for conversations, but the conversations need to be had, right? So anything that we can do to help you, absolutely more than willing. Thank you, Shay, so much.
I appreciate it.
Success looks like having a fully funded and well-known and developed council and mission, bettering the health of our community. Ooh, where did that go?
That was Roberto.
Oh, okay, I was gonna say, my goodness, but hot calling the kettle black. All right, how best to be impactful, still working on that. Engaging folks in our communities in meaningful ways. Delays in county government approving a contractor agreement to complete our CHIP process. Sandoval, oh, this is my Sandoval County, will have significant turnover with several council members' terms ending effective July. Jan Martin, would you like to elaborate on that? Because I know that you have a tremendous wealth of knowledge to share with us.
I don't know about that in the moment, but it's been a challenging year for our council. Still looking at how we can be more effective in the approaches we take. I know what, you know, the health priorities are clear, right? The issues haven't changed, they've just gotten worse. Identifying which ones are priorities, it's, you know, there's a lot of priorities in that regard, but how we as a council can be most effective is really challenging. And it's one that we continue to struggle with. I think we've gotten clearer on some things, but we do continue to struggle with that. There's been turnover at the county government as well, and some position shortages there, which I know everybody's experiencing everywhere. So that has impacted the responsiveness that we have had. That's been great in the past. But we have some challenges hiring our contractor who's supposed to complete our CHIP report. We also will need to be recruiting for several positions, and that gets posted and approved by the county. July comes quickly. So some challenges there.
So as far as Sandoval County, now you all are actively setting up mobile vaccine efforts throughout Sandoval County as a whole through the fine folks at the El Pueblo Health Clinic because
Actively
we have
trying
partnered
to.
with them.
Actively trying to,
Mhm.
not so successful in terms of getting active engagement from folks.
So what do you think the
Um,
challenges are for active engagement? And for anyone out there in Zoom right now, if you are in Sandoval County, I strongly urge you to reach out and we can, like I said, schedule these mobile vaccination events ASAP, because we know how important it is and COVID is not done and folks are still getting sick. We're told today there's somebody out on the floor as we speak that's COVID positive. So, let's see if we can't get some events scheduled. So if anyone is interested, reach out to me ASAP, please. So Jan, what other things are happening for Sandoval County Health Council? You had said that there are several folks that are coming to term. And so are you actively recruiting for board members?
Well, we're trying to, but our recruitment goes through the county. So we, as a council, don't do that independently. It goes through the county to post it and to get the applicants and to have them approved by the commissioners. So that is not something we do directly as a council. And we have to get the engagement of our county government in order to get that process even started. So we will be losing our chair, my position as well. We have another board member who's also announced his, not retirement, but retirement from the council. And we have a few other positions that were filled 2 years ago, but we've not had any active presence from those members in at least a year. So we will have several open positions.
So challenges all around. Okay. Thank you, Jan. So good to see
Sure.
you. How about some in-person comments? Does anyone have anything in person that you would like to share with us?
Come on,
No.
doesn't someone want to stand up? You've been sitting a long time.
Because there's only a few of us here anymore.
I know.
Well, I just want to say thank you so much to everyone. We've got just about, oh, yes. Hi, what's your name?
Hi, I'm Jay Golden, the Health and Wellness Division Director for the Public Suzuki, and I have my sidekick here, Jay Samuels, who's our CHW. So, it's so relieving to hear throughout the state that they're dealing with similar issues that we are. So it's like, but, whatever progression there is, that.
Would you mind coming down so that we can?
What if I bring Mike to you?
Because this way then our folks on Zoom could benefit from what you have to say. All right, come on down.
By the way, the lady from our home, she left her little,
Okay.
water. Probably missed it. Come on down, I feel like it's prices.
Come on down.
Oh. You could just fun it. All right, so please introduce yourself. You can look right there and you can talk to our folks.
Hi, everybody. I can talk pretty loud, so even through my mask. So again, earlier I was stating that it's somewhat relieving to hear that throughout the state, individuals are dealing with similar issues that we have been. I came on board last March. I'm the division director for the Health and Wellness department at Suzuki Pueblo, and having to figure out what the roles and responsibilities are. It's like we're getting back on track, and previously there was the health council there, and the Pueblo was very active, and the priorities were different, and it was primarily focused on culture initiatives, which had happened. And so now we're kind of like trying to determine what would be our priority. And they want to go back and utilize the same one, but that was pre-COVID. And so they were very active, and now you see both of us still sporting our masks. Within the community, they have us, we have to wear them every day. We test every Monday, the beginning of the week. And we do daily temperature checks. So we're still actively, trying to prevent COVID, and it's still here. We're still trying to figure out how we can protect the community, although that's kind of unrealistic because we're gonna get it. We're still, it's happening. But anywho, so right now having to convince the council right now that maybe the priority that they worked on before, which was actually successful, may not be realistic right now because we're still closed. And so, but we're looking at probably like the end of March to open up the building. It's an intergenerational center. And then we have the senior program, we have all the programs in that building. And so I hope that when we do open that, we don't have an increase in cases, but so just hearing everyone's feedback, it's helpful for me. Because then it gives us some ideas, and I guess just that indirect encouragement that, hey, we're not the only ones that are like, oh, struggling, and everybody's talking about shift, they're talking about, all these things. So we're trying our best. We're going to continue to do that. So I don't want to sound redundant, but thank you anyways.
Thank you. Yeah. Real quick, they are only allowing 3 public comments per bill.
Thank you so very much. So we have, Rebecca has just told us that we have, they're only allowing 3 public comments per bill. And so we had a very full auditorium today, and most of these folks are now going to the roundhouse, and they're, in their shirts and representing the health councils, fighting for everyone, every health council to receive reoccurring funding. So we are definitely doing our best, and you can see just our auditorium, there is, like not a whole lot of people left in the room right now. Well, let's see if you can, there we go. Yeah, so, right, there's just not a lot going on in this room. Uh-oh. Well, and this is what we have resorted to after several hours of being in this room with each other. We waited so long to get in a room together. So, okay, now we are going to take a comment from the young lady in blue. Come on down. Hello.
I don't like the comments, so I usually just hide in the Zoom meetings and all too. But since we're the only ones in the room. I'm Brenda Bishop. I'm from Quake County, and with me is Joyce Runyon. And we're the coordinators for the Quake County Health Council. And so you asked about our challenges, and we've been trying to narrow them down.
Because there are so many.
Well, there is, but it has been a really great time of growth for us as well. And so that also becomes a challenge. But one of our biggest challenges is actually getting officers for our council, because we've had a lot of job turnover in our community, but we have recruited a lot of people, but they've only been with us less than a year, and they don't feel qualified. So we just struggle, and it seems like we get a person to do this job, and then somebody leaves, and then we have another hole. But we are hoping that come our March council meeting, we will have all of our officer positions full, because they've all been elected. But we're hoping no one switches jobs between then. But our successes, we've had so many. And so we've decided to narrow it down to we have a grant with the Better Together people. And that grant is to focus on vaccines in an innovative way. And so our innovative way is by video. And we have purchased quality, hard to use video equipment, but we are learning, and a person to train us on how to set it up and use it. And we are learning on the sound. And we have been making videos, and Joyce spends most of her time editing because the screen scares me. Because editing software is almost as scary as the equipment. But we do have quite a few videos in progress and going up, not all on vaccinations, on a lot of other things this month, or we started last month actually, running a series of short, less than a minute videos, or that was our goal, so that they would become reels, and build up our social media on self-care tips. So we would like to invite you, in this month, we launched our, well, I guess it was in January, this is February, we launched our YouTube channel. So we invite you all to go to our YouTube channel, which the channel's name is QCHC for Quake County Health Council. And check out our self-care videos, our vaccination videos, and some of our other stuff that we did during COVID with just cell phones that isn't too great, but we've improved a lot. And so that's our
So can you
success.
give us some more success? So that's a social media. What other successes do you have?
Okay, so since January, we have trained 96 people in the use of Narcan and provided them with Narcan. We have passed out 50 lock boxes. And we have a probably about 60 more people scheduled for Narcan training in the next couple of weeks.
What is the lockbox for those of us who
Lock
don't?
boxes are for people to lock up their prescriptions, their illicits, and we are also pushing them for edibles in order to prevent overdoses. We have some overdose funding, so that's what we're doing there. And we've been working really hard on
Tell them about our health show.
health showcasing. Oh, cool. So one of our other successes is that it's been very, very hard to engage locally people within agencies to come to council meetings. Because if they are working, they're way overworked. And otherwise they're not in offices or whatever. And they're not allowed to go to meetings and things like that. So we have been engaging community people. The people that we're supposed to be building programs for are the people that we've been trying to actually get to attend some of our committee meetings. So we have an intimate partner violence task force, and we have a survivor who came to our meeting and has become a very active member in several of our committees in our council. And she got us into the housing units, the public housing units. And we set up showcases with all kinds of information, vaccine information, healthy recipes. We have a healthy eating, active living committee, intimate partner violence, and of course, substance misuse. And we did 15-minute Narcan trainings, one-on-one trainings. And we did these in like the laundry rooms of the little apartment complexes. So that means we set up displays on washing machines, and people came in and we talked and we really engaged with that group of people that we hadn't been able to engage with before, and even recruited a few more to different committees. So we have people in recovery who are on our substance abuse committee, and that to me is really cool because just like Shay, you know, we're trying hard to get that law enforcement piece. We're trying hard to get the DWI task force people to tell us what the issues are. And we can't get them engaged. But, when you get the people who live in those communities and in that lifestyle engaged, then we have a better idea of what's going on. So that's some of our other successes.
That sounds amazing.
Evangeline has her hand up on Zoom. Oh, we
Yeah.
have to give her a round of applause.
Oh, yes.
Evangeline,
Do I go ahead? Okay.
yes.
Oh, thank you. I'm a little bit under the weather, so my voice is a little bit off, but our challenges have been creating a structure that is solid, or to solidify our structure. Initially, when the pandemic started, we came together as a community using a very successful community impact model. And so what we've been challenged to do is to keep that model going in terms of the structure and being able to pull everybody together again. If we, hopefully not through any pandemic or any type of emergency, but be ready if we do have one. And just for the ongoing collaborative efforts and keeping our resources together. That's been our challenge. And recently, through consensus with the county, we have tremendous support from our local legislators, as well as our commissioners and our county government. We have come to a consensus that we were going to partner with CHI, who I think is on here. Joseph Hill's on here with CHI. So that's where we're headed to next. And we hopefully that'll be the way that we can structure again, like we hope to do. We have high hopes for that. So we're looking forward to that.
That's wonderful. So Evangeline, what do you think the challenges will be from when you implemented this model initially and the world looked a little different? Now that the world has changed, do you see the model being as successful, or do you see that there will be some challenges because it's not so much on the forefront of everyone's purview?
I think it will be. I think it will be as successful. It can be, but our problem has been capacity, and it was. We've been doing it through volunteerism, and what we want to do is, get full-time employee or part-time employee to be able to give it the attention that it needs to keep the communication going. So that's what we're looking forward to, I believe.
Can you share with us a little bit about what this model that you all created, how you developed it?
Yeah, it was started by a community member, and what she did is she brought everybody we could think of together, and we had great participation. And we would meet weekly. We would have work groups. As the pandemic got to its highest level, we were ready. We were able to have vaccine clinics. We're rural areas, so we were able to go out to the more rural areas. And through the collaboration and getting everybody together, it showed that we could address something as big as the pandemic. So we just hope that we can keep the structure in place should we ever need it, or just for ongoing, obviously, attention to our health needs in our community.
So when you created these mobile vaccination events, did you set up ahead of time with folks, or did you simply find a place where you wanted to set it up that was more of a high risk and just go on out, set it up, and then just through word of mouth, folks started to come by or to ask what you were doing?
All of the above. What we did, and together we also created a media effort, and through the task force, everybody contributed to that, and so we got the word out through different media efforts and volunteerism by the fire departments. We went out. I always refer to the Sapio because that's pretty remote in Grant County. We had the Sapio Fire Department helping. But everybody came together at our meetings and said, "Hey, let's do this. This is what we need." And boom, everybody took care of it. Department of Health provided clinics. The schools provided locations. It was that communication that made it happen.
That's wonderful. So what kind of advice would you give to folks who are struggling to create these mobile vaccine events? what would you say to them would be the most successful adventure for them?
I would say that whoever has the most access, for example, your Department of Health, Public Health office, if you have one there, your schools, your medical clinics, your, locations. If you're remote, then go to the people that live in those areas to help you set up, kind of what somebody had said earlier to do. It's just that communication that's the challenge, and how you bring people together. I think somebody from Catron County, was talking about that challenge. But yeah, if you can just get everybody, and we did it through Zoom, obviously, and that was easy for people to attend, and we got it done that way. I know we have others that, I don't know if anybody else wants to make comment for Grant County, but it was pretty impactful.
Wonderful. Thank you so very much. We hope that you are feeling better in no time.
Well, thank you so much.
I wonder, right now we have Girl Scouts all over the state. It is an enormous Girl Scout cookie push. I'm wondering if folks in areas where you need to have some of these vaccine events and whatnot, partnering with some of the Girl Scout troops, because they can just pop up anywhere, and for $5 a box, you've got a little piece of heaven. So you could set up a mobile vaccine event partnered with a local Girl Scout troop, and you could offer $5 a box for cookies and get your vaccine. That might be something to think about. All right, well, I think we are going to release everyone for a break. We got 15 minutes. Clock starts right now, so we will see you back in 15 minutes.
Hi, we'll start sharing the slides too. Okay, welcome back, everyone. Welcome back, everyone in the room. Didn't really leave.
All 5 of us.
Okay, so this is what the rest of our day is gonna look like. I'm gonna give a quick update on that advocacy, but also this was planned long before this committee meeting was placed. So there's been a lot more emphasis on the bill today than we originally had intended, which is awesome, exactly what we want. But I'll give a quick update, especially regarding our new co-sponsors and some junior funding. And then I will invite Maria Perez up, and then we will just do a quick call to action / information about Public Health Day tomorrow at the Roundhouse, which for everybody joining via Zoom will be live streamed, the presentation portion, which I believe starts at 10:30 and goes till 11:45. So can you go to the next slide? So this is just an overview of HB 49, the actions needed and why we need it. Again, I think we went over this. So if you just want to go to the next slide, I do want to highlight our co-sponsors. So our primary sponsor is Representative Allison, and then our co-sponsors are Representative Thompson, Representative Johnson, and then Senator Stefanik. So thank you all to them for supporting this bill. So the biggest question we have, and also for the people in the room, have any of you requested junior funds from your legislators? Have you requested junior funds from your legislator for your health council? Yes. What legislator, and did you ask for a specific project or just general funds?
Funds to maintain our presence on the web, and I think it was the 50,000 that they were told to ask for, and the legislators are Representative Jeff Capfield and Senator Pat Woods and Senator Pete Campos.
Okay, great. So we have one, and then we have another one.
We also got the 50,000. Christine Chandler is the representative to support updating and maintaining a list of resources, and also looking into closed loop referral system software.
Great, and have either of you heard back from your legislators that you received that junior funding? No, neither of you. Okay, anybody online, has anyone requested junior fundings and heard back from their legislators whether they received that funding? Feel free to unmute yourself if you have. No. Okay, well, great. Thank you both for submitting that. If you want to go to the next slide, Carrie, we did just hear from Representative Gail Armstrong that no health councils have requested junior funding from her yet, and she did advise Val to tell health councils to submit a request for junior funds to her. So we will send out her information shortly in a call to action from the info@NM Health Council's email with her email and phone number. So please reach out to Gail Armstrong to possibly get some junior funds for your health councils. Additionally, I know that in person, we had a sign-up letter to sign a letter of support for HB 49 that we will hand over to legislators. We've also put that in the chat multiple times of the Google form that you can fill out, and we will print out all of those signatures and attach them to the in-person signatures we've gotten today and present that as a bill of support for HB 49. Additionally, you can call or email the office of the governor asking to support HB 49 and also the Senate Finance Committee, which there was also a call to action sent out early this morning of the list of people on the Senate Finance Committee and how to contact them. And then all of this information, especially the toolkit, talking points, how to give public comment, how to contact your legislators is all on our website, nmhealthcouncils.org/advocacy, right? It is advocate. I always want to say advocate, but it's advocacy. So if you need any of these resources, a template, any of the above, please visit our website to find those. Go to the next slide. And then this is just a little snapshot of what you will see when you go to our website. So it will be on the top. If you just go to our website, it's right at the top. It says advocacy. You can click on that. This will be the top. There's so much more information on there as well, with additional resources on how to advocate for your health council. Next slide. Okay, and now it's Maria. Marianne's going to come up and introduce.
Maybe we should just ask, is there any questions?
Does anyone have any questions regarding the advocacy, the call to action? Does anyone online or in the building at the moment have any questions regarding how to move forward with the call to action? You can make that call to action right now while I am talking about Maria Perez. So if there are any questions, do we have anything? Okay, so quick story about Maria Perez. So as everyone now, is well aware of the fact I am a project coordinator for Sandoval County Health Council. I go through a tremendous amount of Zooms. We have a gazillion different trainings. We have different series, and they are incredibly helpful. I stumbled upon this particular series with Maria Perez one day, and I was like, oh my gosh, I need more of this facilitator of knowledge in my life. So then I went back through, and for those of you who are not aware, you can go to the website and you can look at the different trainings and whatnot, and they are absolutely worth the look. So to give you an idea, so she was born and raised in Ecuador. She immigrated to the United States in 1990s-ish to pursue her education. A seasoned nonprofit leader, organizer, facilitator, advocate, educator, and coalition builder. She is a firm believer in the power of people coming together to address complex social problems, obstacles, and challenges She spent over 10 years as a healthcare practitioner before turning to policy, equity, and advocacy work. She served as a campaign lead and later as an intern hub manager for the California Endowment's Project Building Healthy Communities in East Oakland, the director of Fair Vote New Mexico, and a campaign manager for Common Cause New Mexico. That's a whole lot of work. That's a whole lot of advocacy work. She believes that democracy is the ultimate health equity indicator and devotes her professional work to ensure that the democratic process is accessible to all people. Maria started the consulting firm Democracy in Action in 2019. It is hugely successful, and launched the nonprofit organization Democracy Rising, where she serves as a co-director since 2020. So I strongly urge you to check out our previous trainings and whatnot. She's a phenomenal speaker. She absolutely, you're going to hang on every word. And without further ado, Maria Perez. I know. Well, the first time I heard you, I was like, oh, let me just keep driving. So thank you so much for being here.
Thank you.
Everybody.
And that's the camera.
Yes, right there.
All right. Hello, everybody online. Hello, everybody in the room. All right. So I'm gonna,
1 second, Maria.
yeah, sure. We're gonna do a little training today around the advocacy issue. We're gonna talk about the difference between lobbying and advocacy. A lot of times people get a little nervous with those lines. So we're gonna have like a very simple, straightforward training on that. And then we're gonna talk about drafting an elevator pitch as it relates to advocacy, right? And you will do it a little bit different if you're allowed to lobby, as opposed to whether you're just doing straight up advocacy. So here we go. We're going to talk about lobbying versus advocacy first.
Just 1 second, we're not sharing on Zoom.
And Rebecca, if people have, like, can we pause along the way and have?
Yeah, I was gonna ask, would you like to do questions along the way or at the end?
We can do it along the way. I'll
Okay.
just pause here and there.
Great, I will sit up here and let you know if you have any.
Okay. All right, so we're loading this up on Zoom. We'll start shortly.
Okay, you're good.
We're good?
Yeah.
Okay. So let's go to the next slide, please. Here's a little agenda for today. We're gonna be together for about an hour. Welcome, everybody. We're gonna talk about lobbying versus advocacy. Then we're gonna talk about the elevator pitch, why have one. We're gonna go through some steps around what you need to do to prep for your pitch, draft your pitch, and practice your pitch. And for those of you, well, both in the room and online, if you have a little pad of paper and pen or pencil, we'll get to that. I'm hoping that it can be sort of like a practice, hands-on training today where you can actually prep and draft and practice your pitch as we go along. So let's go to the next slide, please. All right, thank you. Lobbying versus advocacy. So what's the difference between them? While all lobbying is advocacy, not all advocacy is lobbying. The main difference is that lobbying includes an opinion about specific legislation. So if there's a bill that's been introduced and you're going to ask somebody to support that bill, to oppose that bill, that's lobbying. And that's whether you do it with a legislator or you do it with the public. If there's a ballot initiative that's been introduced and you're hoping that people will vote for or against it, that's lobbying. As long as there's a bill that somebody's got to vote on, rule of thumb, that's lobbying. Advocacy is everything else, right? Advocacy is educating people on the issue. Even if there's a bill introduced, you can still educate people about the bill, about the issues that the bill is addressing, without asking somebody to vote a certain way. So that's broadly advocacy. If you are asking somebody to vote for something, then you are crossing the line into lobbying.
You are allowed as a public citizen, as a private citizen, to lobby, to advocate, to basically speak out, right? This is First Amendment rights. You can do what you want. You can talk to people about the things that are important to you. But you have to be careful about lobbying. If you work for a government agency, sometimes for a nonprofit organization that does not engage in lobbying work, you have to be a little careful. So please do check in with your employer's policies about lobbying. Let's go to the next slide, please. All right, so advocacy. Remember, advocacy is the big umbrella and lobbying kind of falls within it. So advocacy is any action that speaks in favor of, recommends, supports, or defends, or pleads on behalf of others about any issue at all. You're basically just advocating for people in your community. You're advocating for a change. You're advocating for clean environment. You're advocating for funding in public education, whatever it may be, you're allowed to advocate. You're just telling people, educating them about an issue that's important to you, and hoping to change people's hearts and minds about it. In the broadest sense, advocacy is just education work. Whether it's you're educating the public, you're educating elected officials, you're educating administrators, whoever it may be, you're just sharing information with them and hoping that they'll gain a little bit of insight into what is important to you. Advocating for your issue involves just about any form of communications that as you or your organization or as an individual can do. So you can educate folks by having one-on-one conversations with them. You can call them on the phone. You can create little videos and share on social media. You can go to public meetings and share information. You can have a house meeting. For some of you that have participated in some of these advocacy trainings, right? We've talked about the one-on-one meeting. We've talked about house meetings. We've talked about public meetings. Advocacy does not urge those people that you're having conversations with to vote on any issue one way or another. Again, once there's a vote involved, you're veering into lobbying territory. You're just educating them on the issue, telling them why it's important to you, and hoping that they're gonna be moved to also educate others or to think about maybe voting one way or another without you telling them to do so. Let's go to the next slide. Lobbying, on the other hand, is just a very narrow piece type of advocacy. It is communicating with decision makers about existing bills or legislation that they're going to have to vote on. And you're urging them to either vote for it or vote against it. Again, decision makers in this sense can be legislators, elected officials who will be voting on a bill, but also it includes voters who will be voting on a ballot measure. So if there's a ballot measure, the ballot initiative campaign in your community, and you're going door to door to educate people on the issue, the line there again is, are you just educating folks on the issue, or are you also asking them to vote for or against something that's going to be on the ballot? Rule of thumb, though, if you're worried about lobbying, there's 3 components that are necessary for something to be considered lobbying. 1, communicating with decision makers, which also would apply to advocacy. 2, you're communicating about actual legislation, which gets a little blurry, right, around the lobbying piece. And 3, this is the deal breaker, you're asking for their vote for or against that issue. So you have those 3 things, you are lobbying. Let's go to the next slide. Okay, so this is a side-by-side that helps you kind of figure out if you're not sure what it is that you're doing, if you're a little nervous about whether you're crossing over to lobbying when you're not supposed to, this is helpful. So in general, advocacy includes sharing best practices and success stories, or not success stories with folks, sharing nonpartisan research and its analysis. So if you have a report that clarifies the issue that you care about, or there's a website that talks about it, you can share about that. Updating groups or organizations on the status of specific legislation is advocacy, as long as you're not urging people to vote one way or another. And building coalitions about that issue that you're advocating about. So you can build coalitions around education, right? Last couple of years, there was a lot of coalition work around vaccines and vaccination programs with COVID. People were coming together, organizations were coming together, individuals were coming together to get education out. That's advocacy, right? There wasn't a bill associated with that. There wasn't a vote associated with that, but you were forming groups of people and organizations to spread the word to get your communities more educated. So that in general is advocacy. Now we're going to narrow it down a little bit to the lobbying part of advocacy. Lobbying advocates for the adoption or rejection of specific legislation. So we've mentioned that already 20 times. That's the key. If there's legislation, if there's a vote involved, it's lobbying. Preparing materials or arguments that support a position regarding specific legislation. So right now there's a bill, House Bill 49 it is, right? If you are preparing materials that educate legislators about what the health councils do, and you're saying, please support House Bill 49, that's a lobbying activity. If you leave that last sentence out about supporting the bill, then that's advocacy. If you're contacting legislators or their staff in support or opposition to specific legislation, that's lobbying. That's called direct lobbying, you do as an individual. If you're urging other people in your networks, your work, your organization, to contact legislators or their staff in support or opposition of a bill, that's called grassroots lobbying, right? So like you can lobby on your own, you can urge other people to lobby, that's called grassroots lobbying. And any strategy or coalition meeting that coordinate activities in support or opposition of a specific bill, then that's lobbying. So I hope that's clear. Let's pause there for some questions if we have any.
I have a question. Go ahead. So I guess in defining lobbying versus advocacy, in what instances or for what type of people or organizations would, I guess, delineating between the two, is it important? Like understanding that you can advocate, but you cannot go into lobbying.
So the question is, what type of organization, for what type of organization this line becomes important, right? Whether you're advocating or lobbying. That's a great question. So for the most part, in the broadest sense, it would be for any government agency. Usually it's frowned upon if you're lobbying, if you're a government employee, but you can advocate, right? And also nonprofit organizations. If you're a 501c3, you're really not supposed to lobby. Like all your work as a 501c3 is education work, right? If you're a 501c4, then you can lobby. So this is, sometimes you have nonprofit organizations, they have an education fund branch, that's a 501c3, and then they have an action fund, which is the 501c4. So it depends what kind of organization you are. But those are usually the two kinds, nonprofits and government.
Awesome, thank you.
You're welcome.
We have a question, but I do also want to mention that we have both versions of the 1-pager and the 7-pager on our website that mentions the bill and does not mention the bill. So if you know that you cannot do any type of lobbying, we do have a separate document that has no mention of HB 49, and then we have a whole separate one that does mention HB 49.
Do you think people can hear you?
I believe.
Okay, hopefully they can.
Can we mention it again?
So Rebecca's saying, for those of you online, if you go to the website and click on that advocacy page, there's all the materials, the 1-pager, the 7-pager, there's one for advocates and one for lobbyists. So there's scripts and materials that you can use that don't mention the bill whatsoever. And then there's materials and bills that have all the educational components and mention the bill. So you're covered either way.
And then we have a question from Shay, great question. Are you able to mention that the bill is in the House without a pros and cons push?
I would stay away from mentioning a bill that's been introduced at all. So in case of HB 49, I would go and say, hey, legislator so-and-so, I work for the health councils, or my family has benefited from the work of the health councils. I'm a strong supporter of health councils. I know that you guys are going to be looking at this issue this session. Please support health councils, and leave it at that. So like very vaguely, like don't even mention the actual bill to be on the safe side.
So another question is, so the Google form that was dropped into the chat for signatures, was that structured as strictly of support, as a support for not a vote for? Yeah, so the letter they're asking, so we just sent out a link to sign on as a letter of support for health councils. That specific link we did send, I think we will put HB 49 on, but typically the letters of support we send out are strictly supporting health councils. If we send them to legislators, we strictly say, look at all these people that support health councils, like here, a letter of why you should support a health council, and then here are all the people that agree with this letter.
Great. So if there is a letter circulating around for signatures, right, to support, endorse something, just make sure that you read it. You read it through. If it mentions like, hey, support this bill, vote for it, then you make a decision, right? Whether you're able to sign it or not, depending on who your employer is, what you're able to do. Did you have a question?
Yeah, my question kind of segues back to the topic around who should be concerned about delineating between lobbying and advocacy. The Health Equity Council in Bernalillo is a 501c3. We don't have a 501h branch where there are very clear lobbying percentages depending on your income level. So I've been researching into the IRS code, and what I found is that it says for a 501c3, you could potentially be have your status revoked if the organization conducts what they consider a substantial percentage of time, volunteer resources, and then overhead and other things that are funded towards lobbying work. And so I'm wondering, we do some grassroots, what would be considered lobbying. Does anyone have a rule of thumb or some kind of a metric as to what is substantial for a 501c3 when it comes to the percentage of resources that you're devoting directly towards lobbying, whether it be direct or grassroots?
That's an excellent question. So the question is, 501c3s are allowed to do a little bit of lobbying, but it's like a little vague, right, as to how much or what kind of work. Rule of thumb, in the work that I do, and I do 501c3 work, is that you should keep any lobbying, try to stay away from lobbying work altogether, because you don't want to get in trouble with the IRS or anybody else. But that percentage is under 20%. So under 20% of your time, your staff, your resources, your budget can go into grassroots lobbying, right? But be careful about that. I mean, I like to be really clear about it. My 501c3, we don't lobby, and that's that. Thank you.
We have a question. I just have a question.
Yeah.
Would you say that's the same rule of thumb for signing a letter?
Signing a letter that asks a legislator to vote for or against the bill, yes, that would be part of that.
Yeah, no more questions.
All right, so let's go to the next slide. And here we have two examples, right? My thought was we're gonna have a room full of people and people can yell out what they think it is, but we'll go with what we have. So the first bullet point here, I'll read it out loud. It says, This is what you would be telling a legislator, right, or a decision maker. The Juvenile Justice and Delinquency Prevention Act regulates the incarceration practices among juveniles, including institutionalizing status offenders. Research shows that incarcerating low-risk offenders is related to higher recidivism rates. What do you think? Is that lobbying or advocacy? Why?
It's just information.
It's just information. There's no bill attached to it, right? Now, we go to the next point. We urge you to support the Juvenile Justice and Delinquency Prevention Act to reduce incarceration of low-risk offenders and lower recidivism rates. It's lobbying because it says we urge you to vote a certain way, right? So it's kind of the same information. Actually, you're giving more information. The first bullet point is more educational. The second point, you're just kind of like asking them to do something. You go straight to the ask. The first point is giving them information. To our point in terms of health councils and the funding for health councils. New Mexico health councils link the state health department to critical community-based health planning. County and tribal health councils successfully involve community members and advocate for diverse and underrepresented communities. But from 2013 to 2022, county and tribal health councils receive well under 10% of what is considered to be an adequate level of funding. We need to support our county and tribal health councils to support the health of our communities. What is it? Advocacy, because why?
Information.
And we're not mentioning a bill, right? We're close, but no cigar. Okay, the last bullet point. We urge you to support HB 49 to give New Mexico health councils the financial resources they need to carry out critical public health functions based on community data, need, and priorities. Without proper state funding, our health councils aren't able to do their work, thus undermining their important contributions to long-term community health issues. It's lobbying because you're mentioning right there, we want you to vote for this bill. However, both of these bullet points, you're providing a lot of education, right? So like on the Delinquency Prevention Act, that lobbying ask was just the ask. In this example of for HB 49, you are asking the ask, but you're also including a lot of education. So just sort of pay attention to that, right? Because I go down to the roundhouse and I see people running into their legislators and they're like, Senator, support bill so-and-so. And it's like, there's no conversation about what the bill is, right? That senator is hearing from 60 people about 60 different bills. Do they know what you mean when you say HB 49? If you don't provide a little bit of education about it. So when you're talking to your legislators, if you're advocating, you absolutely want to educate them. If you're lobbying, you also want to educate them, right? Even as you're making an ask for them to vote one way or another. All right. Any
One
questions?
question, yeah. So he said, our health council is not a 501c3. We have no official status other than currently being recognized by the county as an official health planning body. As a health council steering committee member appointed by our county commissioners, do I need to be worried at all about lobbying by signing either an advocacy letter or a lobbying letter as a health council member?
You absolutely don't have to worry about the advocacy letters, but for the lobbying letter, I would check with your commission, right? What do you think, Rebecca?
No professional.
I mean, you're not a 501c3, you were appointed by a government body, right?
Yeah, I mean, just recognize, not appointed, recognize.
I mean, I think that's really safe for you to lobby as an individual, but I would check in with whomever's recognized the council that you're working with. Good questions. All right. Now we're going to move into the elevator pitch. So what is an elevator pitch? Joyce.
She signed that and just leave off her title for the advocacy stuff, and then she's just a person saying, I want you to support this bill. Would that be okay?
Yeah, that's an excellent point. And actually, I do that a lot, right? Where I sign up for public comment, or I sign an endorsement letter or whatever, even if it's a bill, I sign as my own person with my address as like a resident of Santa Fe, right? And I don't put in like my name and then my title, my organizational stuff. So you can always do that. Again, as a private citizen, you're allowed to lobby, you're allowed to advocate. You just have to be careful to like tie your employment to that. Okay, so the elevator pitch. The elevator pitch is basically a short speech that you have memorized in case you get a chance to talk to a decision maker. If any of you have been to the roundhouse, right, you know that it's crazy and people are coming out of committee and like getting into the elevator, and sometimes you just happen to be trapped in the elevator with your senator, and that's an opportunity that's golden and you can't let it pass. So the elevator pitch is like a 2 minutes or less little pitch. You wanna sell them on something, you want to change their mind, you want to solidify the way that they're feeling about a bill. And you just have a very limited amount of time. This is why we call it an elevator pitch, because it's, you know, the time that you get once riding from the first floor to the third floor with somebody. The goal is to plant a seed of curiosity so that after the proverbial elevator doors open, your audience, your senator, your decision maker is curious and wants to know more, right? They'll say, I'd love to keep talking about this, come find me, or that's really interesting. Do you have a one-pager on this issue? So it's a golden opportunity. You want to get good at this. You really can't wing it. You need to have something prepared, because when the time comes, it's chaos, right? And you just want to have it pat. You want to have something that you practice with your, I tell people to practice the elevator pitch with 3 different people. If you have these people in your life, right? Somebody way older than you, like your grandma, somebody way younger than you, like your nephew, and somebody who just has a completely different life experience from you. So like if we're talking about health councils, talk to your friend who works at the bank and knows nothing about health councils, right? Talk to somebody who's completely removed from your world. And just practice it, get their feedback, change it up, practice it 10 times, and then you'll be ready to, you know, get that opportunity and leverage it when it comes. You want to be passionate about the things that you're talking about. You want to be concise and you want to be succinct. And again, you just practice, practice, practice. The last thing you want is to have that golden opportunity and then you fumble and you get tongue twisted and then you lose your audience and perhaps create more harm than help for your issue. Let's go to the next slide. So again, I don't want you all to wing this, right? Prep it. If you're online and you have a little piece of paper and a pen, bring it out. If you're in the room and you have a little piece of paper and a pen, bring it out. You want to prep. You want to think about who your audience is. You want to think about what your purpose is, what your context is, what your credibility as an individual is. You want to think about the emotions that you want to elicit in your audience. And you want to think about the facts. So we'll go through these one by one in the next few slides. So your audience, before you begin, we were just talking about junior funds. We were just talking about Gail Armstrong saying, reach out to her if your health council is wanting to get some funding, junior funds funding. So for the sake of this conversation and the rest of this presentation, let's think about Gail, right? Gail is your audience. You must be clear about who you're making your pitch to. Now we know we're making our pitch to Gail. Your pitch will be different if you're talking to Senator Campos or Representative Allison. Like, it depends, right? Who you're going to talk to is going to shape what your conversation is, what your pitch is. But for this purpose, we've got Gail. She's our audience. Do a little research, find out what she cares about, right? Find out how she's voted on some of these issues before. You don't need to get in the weeds about it, but you just kind of have to know, right? Does she care about children? Does she care about education? Does she care about the environment? Like, what are the things that she really cares about that is going to catch her attention if you talk to her, if you relate to her on those terms? And then also, what power do they have? you gotta be careful, right? Because you might have a great state representative who you know personally, who you like, who's definitely gonna listen to you. Great. Are they on any of the committees that are gonna vote on your issue? If not, that might not be where you want to prioritize these conversations. So figure out who you're talking to, figure out what they care about, and figure out what power they have. Are they actually able to help you move your bill, your issue forward? Let's go to the next slide. Once you figure out your audience, what they care about, what power they have, think about your purpose, right? What is it that you're trying to achieve? If all goes perfectly well, best case scenario, what is the outcome that you want to see from all your advocacy and all the work that you're engaged in? Based on that, right? So in this case, the purpose is to get funding, to get junior funding for your health council. That's the North Star. That's what you want. In order to do that, to get that, what do you need this person to do? What do you need Gail to do? So we were talking with Brenda a little while ago. What if Gail is not your representative, right? Well, Gail said that she wants you to reach out to her to get junior funding. So the way I read that is that she's willing to advocate for you with her colleagues on the committees that are going to vote for this, right? So that's the purpose. You want to talk to Gail because she's made herself available to help you. You want her to help you, and that's the ask. So let's go to the next slide.
Next slide, okay.
Your context before you draft your elevator pitch, you also want to get a little information about if this issue is a hot button issue, if people are talking about it, if they're not, if people are talking about it, what are they saying? What is the opposition, right? Saying if you're trying to get junior funds for your council, who is talking to Gail and other representatives saying junior funds should absolutely not go to health councils, and this is why. You need to know what the narrative is. So yeah, just get a little information about the bill, the issue, the people care about it, if people talking about it, is this a bill that seems like it's going to skate through? Or are there people that are trying to stop it from going through? So that's your context. Let's go to the next slide. Your credibility, this is important. So again, you'll have maybe 2 minutes, right? With whomever it is that your target audience is, in this case, Gail Armstrong. You need to figure out how you will present yourself when you open up your elevator pitch, right? Hello, my name is Maria Perez. Right? What is it that gives you credibility to talk to this person about this issue? You can say, I am a coordinator for my health council in my county or my tribal council. You can say, I work with my health council on, drug prevention or vaccination education, whatever it is. Like, how do you present yourself so that immediately that person that you're talking to says, okay, I should pay attention to this person. They're credible. They have information that I should be listening to. If you just present yourself like, hi, I'm Maria Perez, I want to talk to you about this or that, they have no context, right? They don't know why you should be considered an expert or consider a credible source of information. Let's go to the next one. This goes back to our storytelling training that we did some months ago. It's important to know what emotions you want to elicit from your target audience. And this really depends about what they care about, right? If somebody already cares about health councils, as is the case right now in our example with Gail Armstrong, what is the emotion that you want to elicit from her, right? Is it rage? Is it hope? What is it? Is it curiosity? Is it inspiration? What is it, right? It's going to be very different from somebody who's already predisposed to support your issue than somebody who maybe is predisposed to oppose your issue or just has no idea about your issue. Or a lot of these newly elected representatives probably don't know much about health councils, right? They're kind of like a blank slate. So like, do you want to inspire them? Do you want to give them a sense of impending doom? That you have to be very strategic about this. Once you figure out what emotion you want to elicit, then you figure out what story you're gonna tell them. The way that we elicit emotions is by telling people little stories, right? You have 2 minutes to tell someone their story, this story that you're gonna tell, maybe 1 minute if you leave, time for other conversations. So what is the story that you're gonna tell? Are you gonna tell the story about how in your community, your health council did this thing and it was amazing and it changed the lives of people, including your auntie? Or are you gonna tell a story about how when the funding went away from your health council some time back, the mortality in your county went up by X percentage because all of a sudden there wasn't that support and that network, right? Very different emotions. So figure out what it is that you want to elicit and then craft your story around that. Let's go to the next one. And finally, the facts. Before you talk to somebody, you have to be clear about some facts, and you don't have to be in the weeds about it. This is where the Alliance comes in super handy because they have that 1-pager, they have that 7-pager. So you already have information about the facts, what is considered adequate funding for health councils, when did the funding go away, what happened, what happens when councils are properly funded. They have citations, right, to like different studies and reports and things like that. So you want to make sure that you have some sort of fact sheet that you're going to bring to you when you go lobby or advocate, right? If you're lobbying, your materials will have the bill number and the ask. And if you're advocating, it won't have the bill number, but it'll have all the education, all the facts. So before you head out to talk to any legislator, make sure that you have a 1-pager so that when the elevator doors open and they say, tell me more, you say, here you go. I'll follow up with you in a couple days. All right, do we have any questions? Okay, so let's go to the next slide, please. So this is the part where we're gonna work, hopefully have a little practical application. So think about this, right? You're talking to Gail Armstrong. In 15 seconds, I'm gonna give you a minute to think about this. How are you gonna introduce yourself? How are you gonna greet them? How are you gonna present yourself? What are you gonna say about yourself that makes you a credible source of information? And how are you gonna tell them in a nutshell what you wanna talk about, right? So this should take, it may take like 10 minutes to draft in reality, but it's gonna take 15 seconds to convey. So just take a minute and jot these thoughts down. How are you gonna greet them? What is your name? What is your, why are you a credible source? And what is it that you wanna talk to them about? And then if we have anybody on the Zoom who wants to be put on the spot and share, that would be great, or anybody in the room, our vast live audience.
We have Shay, we have a taker.
Shay? Go for it.
All right. I jotted it down just real quick. Hello, my name is Shay Yantis. I'm the coordinator for the Catron County Health Council, and I would just briefly like to speak with you regarding the importance of health councils in our communities across the state.
Perfect. Thank you, Shay. I didn't time that, but I think that took less than 10 seconds. Do we have anybody else that wants to share?
Just the intro part?
Yep.
Oh, sure. For that. Hi, Gail. I'm Jessica Strong, the Social Services Manager from Los Alamos and new to our county's Health Council. and would love to talk to you about the important work that health councils are doing across the state.
Perfect. Thank you so much. So not a whole lot of in the weeds information, right? But like you caught her attention. You introduce yourself as a credible source and you make clear what it is that you want to take, 2 minutes away from her to talk about. Perfect. Okay, let's go to the next slide, please. Okay, next you're gonna say that, she's gonna say, okay, great. And then it's your turn, right, to actually present your pitch. So how will you present the problem as you see it in 40 seconds or less? So you want to state the problem. You want to illustrate it using a vivid storytelling. Remember, you're going to do this in 40 seconds or less. So the story is like very short. If possible, the story is about yourself, about somebody in your life, your parent, your kid, your partner, your neighbor, right? The students in your school, something that is very personal. You don't want to talk generally about some people out there in the community. It's like you want it to come from your heart. That's going to elicit the emotion again. So what is the vivid story that you're going to tell? You want to back it up with one data point if you can. And you want to connect it to why, in this case, Ms. Armstrong should care about it. So try to, take a minute again to quickly jot some thoughts about this. What is the problem as you see it? Illustrate it with a story. Back it up with one data point and connect it to why she should care. So I'll leave you a minute or so to do this, and then we'll get somebody to volunteer. It's weird to do this, not seeing anybody. Yeah, I wish I could see your faces on Zoom, but I have my lovely audience here. All right, do we have any volunteers? And we can just go point by point. So anybody want to share how you state the problem as you see it? Anybody? Let's have you, Brenda.
I'll give it a try. So I would start with saying, as you know, the CDC has determined that fentanyl is one of the #1 leading causes of death in adults ages 25 to 45, just recently stated that. And our health council has been working very hard because we've lost so many of our people due to overdoses. So we've been working very hard to train our community in responding to overdoses and save lives. And we'd like to have your continued support in our efforts.
Awesome, Brenda, you hit all of them. So I'm gonna paraphrase for our folks on the Zoom. So Brenda said, stating the problem, right, that as you know, Gail Armstrong, the CDC has come up with some studies that show that fentanyl is a big problem and it's causing the death of thousands of people in our communities. Illustrated using a vivid storytelling. This, I think you could fill out a little more, right? She said, in our own community, our health council has been doing a lot of work to educate the community and try to prevent some of the fentanyl deaths. We've had some fentanyl deaths in our community. It would be great to say, be a little more specific about that, right? Like in our schools, we've lost 5 students, or my colleague, whatever, right? So like it's a personal thing. And then she said, we would really love your continued support to our health councils because we're doing this important work. Something like that. Did I sort of get it?
Pretty good.
Okay, cool. So that was great. 30 seconds maybe for that, right? Let's go to the next, unless we have somebody online that wants to share. Any hands? All right, let's go to the next slide.
Or not.
Okay, so you present yourself, you present the problem, now you present the solution, right? You definitely don't want to be a bummer. You don't want to just leave them hanging with a problem. You want to leave them hanging with the possible solution. So again, in 40 seconds or less, state the solution. Again, illustrate it with vivid storytelling. Hopefully this ties into your little story that you told while you were stating the problem. Back it up with one data point if appropriate, or if you have it. And then hand them your data page, right? Your one pager. So let's give you all about a minute to jot some thoughts down about how to present the solution. How do you state the solution? How do you illustrate it with a story? How do you back it up with one data point if you need to? And then what do you say as you're handing them over your one pager, your fact sheet? So take a minute and then hopefully somebody will volunteer. Do we have anything in the chat? Okay. All right, how are we going to present our solution? Do we have anybody? Any hands up? All right, live audience. Who wants to go?
The solution for Brenda's or the solution for like
Yeah, sure. The solution to Brenda's point is, as we had that as an example before. How would you state the solution? Like, what is the solution?
With increased funding, we will be able to have the materials to educate and help the people in our community to be able to take care of themselves and to know that there are options for them to do something other than substance misuse. And we can provide them with more mental health benefits and ways to address those needs instead of turning to substances and self-medicate. We
Perfect.
really appreciate your support to have that happen, not only in my county, but in the counties across our state.
And then you hand her the one pager and you say,
Thank you. I appreciate your time.
perfect. So Joyce is saying, Joyce and Brenda from Quay County, right?
Yeah.
So Joyce presented the solution just straight to the point. You don't have a lot of time, right? So she said, increased funding for our health councils will really allow us to do the work of supporting people, educating people, have the tools and resources so that we can make sure that in our community, folks are not turning to substance abuse, that there's options, that there's places where they can get help. I'm totally paraphrasing, but right, that's the solution as you stated. We were missing a vivid story, so can you pull one out of your head right now?
We actually have somebody on our health council who is a recovering user and has helped us tremendously to make connections and inroads with a demographic that as a health council, we haven't been able to reach before. So we are so excited that we are actually breaking into these areas that we need to help people. We need to help our community. And so really appreciate your support.
That was excellent. So Joyce's story was, we actually have, it's a true story, she says. Yeah, and we trust her. She said there's a member of our health council who's former person who's been struggling with drug addiction, and he's been tremendously helpful to our health councils in reaching that demographic that as a health council, maybe we don't have direct connection with. And having that help, having resources will just make a huge difference in our community, something like this, right? But all of a sudden, there's this person, right? There's this individual that you're connected with who has dealt with this issue in their own lives, who has overcome something. There's nothing like a story of overcoming adversity, right? So all of a sudden you have her ear and she's feeling it in her heart and she says, man, yeah, that's powerful. There's this people that can help us link to this demographic of folks who are struggling with substance abuse. Health councils can support those people, right? Then she handed the one pager, the fact sheet, and she said, thank you so much. We count on your support. Have a wonderful day. That's it. Okay, great. Let's go. Yeah.
Sorry. I don't mean to interrupt, but Valeria is asking that when we conclude here today, if everyone can join them in room 307.
Okay, so if everyone online can also join room 307 for the hearing after we're done with this, we're going to be done in just a couple minutes. Do we have anything on the chat? Okay, let's go to the last. Next slide. Okay, and the ask. This was already included in Joyce's pitch before, but basically, if you haven't made an ask, you've wasted your time and you've lost an opportunity and you've wasted their time. All of this, like saying the problem, stating the solution, backing it up with a vivid story about somebody in your community that's an actual person whose life has actually been touched by this. If you don't say, therefore, I'm asking you to blank, it's a waste of everybody's time. So make sure, sometimes it's hard to make an ask, right? It's not the most comfortable thing to do. Make your ask. This is the whole purpose. Remember when we were talking about what your purpose is to get this funding, right? You're not going to get the funding if you don't make the ask. So in less than 10 seconds, tell them directly what you need them to do. Ask them directly if you can count on them to do it, right? It's not enough just to say, I want to ask you to support this bill, because they can be like, okay, they're not on the hook, right? But if you say, can we count on you to support this bill? They're either going to answer yes or no, or they're going to deflect. And then you know, right? You know that they're not likely to support it or that they need more work. So let's have somebody directly make an ask. And how would you say this? Live audience, unless there's somebody online that wants to do it.
Okay, I guess.
Remind me your name. From
Jessica.
Jessica from Los Alamos. Okay, what's the ask?
So Gail, can I ask that you support funding for health councils across the state? That side question, is that still advocacy? I'm just asking for general support, or is that crossing the line?
That would be lobbying, because you're asking her to support a certain outcome.
So ask, Gail, can I count on you to support health councils? However you can. And I will follow up with you in a couple of days.
Yep.
If you have any questions.
Right. So that's on the advocacy side, right?
Yeah.
So like on the advocacy side, Jessica saying something like, Gail, I want to ask you to do whatever you can to make sure that the health councils are supported throughout the state. We didn't say, can we count on you to do this? But she did say, I will follow up with you in a few days to see how your efforts are going, right? That's on the advocacy side. You could also say, because Gail, you know that Gail's going to vote for this, right? So like, you're not asking for her vote necessarily. You're asking her to advocate with her colleagues that are on these committees that are going to vote on this. So that's the ask for Gail, right? Gail, thank you so much for your time. I'm going to ask you to please work with your colleagues so that they will vote to support this bill. If you can lobby, or work with your colleagues so that they will support health councils if you can't mention a bill, right? Can I count on you to do that? You know, my representative is so-and-so, they're on this committee. I'm not so sure that they're supportive of this. Can you please help me get my representative to support health councils? So you want to be really clear about what your ask is, and you want to put them on the hook, right? So it's not just like, if you possibly could, it would be great if you might think about helping, right? It's like, I want you to help, and I'm gonna count on you, and I'm gonna follow up with you to see if that happened. Great. Do we have anybody online that wants to add anything, share anything? Or do we have any questions on the chat?
Could you ask them to share your story with their colleagues?
Yes.
Or to support health council?
That's a great question. So Joyce is saying, can you ask Gail or whomever you're talking to share the story that you shared with them, right? With their colleagues. You absolutely can. Not only that, but you can have that story as a little blurb on your one pager, right? There's little videos that you can put on social media and like share with, you know, at Gail Armstrong. Here's a little video about my story, my community. So there's, again, nothing like storytelling is going to move people, right? To feel a certain way, therefore to act a certain way. So always, in any way that you can, make sure that a story is stuck in there, even if you're not talking to someone directly. Yes. All right, next slide, please. Okay, so you are done. You wrap it up. You thank them for their time and attention, and you tell them what your next step will be, which Jessica said, I'm going to follow up with you in a week or whatever it is. What you're going to do, or you're going to say, thank you so much for your time. I will follow up with you next week, or I will talk to my representatives who are so-and-so and so-and-so, or I'm going to go back to my council and tell everybody that I had this excellent conversation with you. Help, you know, you're asking them to do something. Share with them what you're going to do, because it's a partnership. Now you're working together. Okay. Let's go to the next slide. Now you put it all together. So if you've been taking notes, just jotting down your thoughts on the Zoom, you put all your little jotted thoughts together, and then you speak it, right? You read it out loud. And this is your checklist. Is this under 2 minutes? If it's not, don't speed up. Edit some things out. You don't want to be talking at somebody really fast. That's not a good advocacy practice. Does it have a good flow? Do you feel like you're, you know, presenting yourself, stating the problem, stating the solution, telling your story, making an ask, right? That's the flow. Are you comfortable with it? Do you feel like your point is getting across? And once you have that, you have your little blurb, your little elevator pitch. It's under 2 minutes. You feel good about it. It has a good flow. It's making your point. It's time to practice. Again, if you can do it with your grandma, with your nephew, with your friend, practice, practice, practice a few times. I say no less than 10 times. And then you're ready to go down to the roundhouse, find Gail Armstrong, and share your elevator pitch with her. And again, you can do an elevator pitch for any audience. So you might want to prep one for Gail Armstrong, but it might be good for you also to prep one for your representative who's going to be voting on this issue, who may or may not be supportive of this, right? So that's where that research in terms of what do they care about, what is their vote history like, right? Just make sure that you're speaking to your audience with some knowledge of who they are and how to move them. All right, I think that's it. Do we have another slide? There's the thank you slide. So thank you all, this beautiful live audience, and everyone on Zoom. I hope that was helpful, and I hope you all will draft an awesome and moving elevator pitch and start doing either your advocacy or your lobbying around this this issue. Thank you so much. Have a good afternoon. Yes.
So in terms of tribes being able to advocate, are there any rules against that because or are they treated as like governmental organizations?
I think that tribes would be considered governmental agencies or organizations, but just check. But just like anybody else, if you are a member of a private pueblo, you can advocate or lobby all you want as an individual.
Just not the tribe itself.
Right.
Okay, thank you.
thank you, thank you, thank
We have a
you.
lot of comments in the chat. Thank you, very informative. Thank you, Maria. Thank you so much for this information. Being new to this process, this was very helpful.
Awesome.
Even though we couldn't see them.
Thank you so much for. Thank you, everyone online. Thank you to our dedicated, I feel like it's followers at this point. I just want to remind everyone that we will be live streaming Public Health Day tomorrow. I put the link in the chat. You can also find it on our website, on our statewide meeting, 2023 statewide meeting webpage. Right at the top, there is a link that will take you to the link to watch Public Health Day tomorrow. If you have any questions, please feel free to email us at info@NM Health Council. What time does the stream start tomorrow? It starts at 10:30 to 11:45. I also sent out the agenda for Public Health Day with the email that you got with the link to this Zoom. So it should be called something statewide meeting should be the email. So the agenda is there as well. You can also find it on NMPHA's website. Again, if you have any questions, please let us know. But again, thank you all for your time and energy and coming out today to our 2023 statewide health council meeting.
All right, so you're taking, how much do we have? Flowers, have a ton. I have to call for the shuttle because I left my